webinar, The Effective Publication Strategies at the International Reputable Scientific Journal. This webinar hosted by Department of Nursing, Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang. The Honorable, the Dean of Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, Head of Nursing Study Program, Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang. The Honorable Distinguished Speaker, Professor Ji Yuliu PhD from National Taipei University of Nursing and Health Sciences, Taiwan. Professor Dr. Nursalam M. Nurse from Universitas Erlangga. And Nurse Satria Pranata M.Kep, PhD candidate from National Taipei University of Nursing and Health Sciences, Taiwan. And all of the participants this webinar. We would like to express our warmest and greatest welcome appreciation for attending today. Before we start the agenda, we listen recitation of the Holy Quran, Al-Mujadilah, will be delivered by Olivia. Would you please?
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
A'udzubillahi minasyaitonir rajim. Bismillahirrahmanirrahim. Ya ayyuhalladzina amanu idza qila lakum tafassahu fil majalis تفسحوا في المجالس فافسحوا يفسح الله لكم وإذا قيل انشزوا فانشزوا يرفع الله فانشزوا يرفع الله الذين آمنوا منكم يرفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير يا أيها الذين آمنوا إذا ناجيتم الرسول إذا ناجيتم الرسول فقدموا بين يدي نجواكم صدقة ذلك خير لكم وأطهر فإن لم تجدوا فإن الله غفور رحيم أأشفقتم أن تقدموا بين يدي نجواكم صدقات فإذا لم تفعلوا وتاب الله عليكم فأقيموا الصلاة وآتوا الزكاة وأطيعوا الله ورسوله والله خبير بما تعملون صدق الله العظيم. Wassalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, we listen to the song Indonesia Raya and March Muhammadiyah together. To all of the participants, stand up please. Welcoming speech by Vice Dean of Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang. We invite Dr. Muhammad Fatkul Mubin, Magister Keperawatan, Spesialis Keperawatan Jiwa. Would you please?
A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. The honorable speakers and Team Clinic Journal in this webinar. This is Profesor Nur Salam from Erlangga University. Terima kasih Prof atas kesediaannya berbagi ilmu bersama kami, dan tentu kami akan merasa sangat senang adanya Prof di acara webinar kali ini. And then Prof Jie Yu Liu from NTU NHS Taiwan. 谢谢Liu Jieyu Jesu de Xinji. Thank you, Prof, for your sharing your knowledge with us. And then Associate Professor Satria Pranata from Unimus. Terima kasih Pak Satria, yang muda, berpikiran global, dan tentu Unimus mempunyai perasaan bangga dengan adanya Mas Pranata. And then participants and committee who have facilitated the current webinar, especially wabil khusus Ustadz Sriono yang hari ini mendampingi kita agar acara kita berjalan dengan lancar dan diberkahi Allah Subhanahu wa Ta'ala. Assalamualaikum warahmatullahi wabarakatuh. Good morning. The topic of this webinar is very important. Effective publication strategy of international reputable scientific journals. I think this is a very good and very important topic. Scientific publication have become a necessity for scientists. The publication is a testament to their work, not only for career development, but more importantly, the benefit of science for many people. Therefore, the quality of article to be published in reputable journal requires strategies that must be understood. The current webinar is very appropriate to get the strategy because there are experienced speakers present. Okay, let's make good use of this meeting. Faculty of Nursing and Health Science committed to leading research and publication. More publication will not only benefit the lecturers themselves, but will also benefit the institution. I hope that the nursing study program will continue to develop and be more creative in scientific activities in the future. So take advantage of existing interinstitutional collaboration, both in the field of research, international seminars, curriculum development, as well as lecture and student exchange and other activity. I also hope that this activity will be useful for the participants and that there will be a follow-up activity, clinical journal with experienced resource persons. Let's come back to the journal clinic event 3 weeks from now by bringing a draft of your article and we fix it together. Okay, thank you. Have a nice webinar. Let's open by reading Basmalah together. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Mr. Mubin. We listen to the recitation of the prayer. Will be delivered by Mr. Siono, MPD. Would you please?
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Bapak, Ibu, dan saudara sekalian, mari kita tundukkan hati dan jiwa kita untuk bermunajat kepada Allah, memohon kepada ribaannya. Semoga acara webinar pada hari ini senantiasa diberkahi. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdasy syakirin, hamdan na'imin, hamda yuwafi ni'amahu wa yukafi'u majidah. Ya Rabbana lakal hamdu kama yanbaghi lil jalali wajhikal karim wa 'azimi sultanik. Allahumma salli wa sallim wa barik ala nabiyyina Muhammadin wa ala alihi wa ashabi ajma'in birahmatika ya arhamar rahimin. Allahumma ghfir lil muslimina wal muslimat wal mu'minina wal mu'minat al ahya'i minhum wal amwat innaka sami'un qaribun mujibud da'wat ya qadiyal hajat. Allahumma arinal haqqa haqqan warzuqna tiba'ah wa arinal batila batila warzuqna ijtinabah. A'udzu bi kalimatillahi tammati min syarri ma khalaq. Ismi sayun fil ardi wa la fis sama'i wa huwas sami'ul alim. Bismillahi tawakkaltu 'ala Allahi la haula wa la quwwata illa billah. Allahumma inni as'aluka ya Allahu bi annaka al-wahidul ahadus samad alladzi lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Anta ghafira li dzunubi innaka antal ghafurur rahim. Allahumma ihdinas siratal mustaqim. Allahumma ya Allah ya Rahman ya Rahim ya Malik ya Qudus ya Salam. Kami agungkan segala asma kebesaran-Mu ya Allah. Engkau zat yang mulia. Kami tadahkan tangan ke hadirat-Mu karena Engkaulah zat yang maha mengabulkan segala permohonan hamba. Untuk itu dengan mengucapkan puji dan syukur ke hadirat-Mu atas segala rahmat karunia-Mu yang telah Engkau limpahkan kepada kami. Pada saat ini kami hadir bersama secara virtual dalam rangka webinar Jurnal Internasional Berreputasi Program Studi S1 Keperawatan Fakultas Ilmu Keperawatan dan Kesehatan Universitas Muhammadiyah Semarang. Untuk itu ya Allah ya Rahman ya Rahim, jadikanlah acara yang kami laksanakan ini sebagai acara yang Engkau ridhoi, Engkau berkahi, yang mendatangkan karunia rahmat taufik dan hidayah dari-Mu, dan membawa kemajuan bagi Universitas Muhammadiyah Semarang yang semakin maju dan hebat, menjadi universitas yang unggul, berkarakter, berbasis teknologi dan berwawasan internasional, serta membangun manusia Indonesia yang berkualitas, berakhlak mulia, beriman dan bertakwa kepada Engkau ya Allah. Ya Allah ya Fatah, berikan rahmat kepada kami dari sisi-Mu, dan sempurnakanlah bagi kami petunjuk yang lurus dalam urusan kami. Berikanlah hati kami kesabaran yang luas, kedamaian, ketenangan, dan keikhlasan. Berikanlah kami kejernihan pikiran, sehingga dapat dengan bijak dan sabar menyikapi segala ujian-Mu. Ya Allah, kami mohon dengan zat-Mu yang mulia, kemurahan-Mu yang kekal abadi, dan dengan nama-Mu yang agung, jadikanlah awal hari ini sebagai pembuka pintu-pintu rahmat-Mu. Di pertengahannya memperoleh kebaikan, pertolongan, cahaya, berkah, dan petunjuk dari-Mu. Dan jadikanlah penghujung hari ini untuk memperoleh keberhasilan. Ya Allah, ampunilah dosa-dosa kami, dosa-dosa orang tua kami, guru-guru kami, keluarga kami, sahabat kami, serta kepada seluruh kaum muslimin dan muslimat, baik yang masih hidup maupun yang sudah wafat. Berilah kami dan mereka kebaikan di dunia dan di akhirat. Jagalah kami dan mereka dari segala macam bencana di dunia dan ketakutan pada hari kiamat. Berilah kami ilmu yang bermanfaat dan amal yang soleh. Peliharalah kami dari segala bentuk maksiat yang nampak dan yang tersembunyi. Mudahkanlah kami untuk mendapatkan rezeki yang halal, berkah dan luas. Dan akhirilah hidup kami ya Allah dengan husnul khatimah. Ya Allah, terimalah dari kami amal dan doa kami. Sesungguhnya Engkau yang maha mendengar, lagi maha mengabulkan doa. Rabbana zalamna anfusana wa ilam taghfir lana wa tarhamna lanakunanna minal khasirin. Allahumma a'inna ala zikrika wa syukrika wa husni ibadatik. Allahumma inni as'aluka ilman nafi'a wa rizqan thayyibah wa amalan mutaqabbala. Allahumma inni as'aluka al-afwa wal afiyah wal mu'afatad da'imah fid dini wad dunya wal akhirah والفوز بالجنة ونجاة من النار. اللهم إني أعوذ بك من الشك والشرك ونفاق وشقاق وسوء الأخلاق. اللهم إني أعوذ بك من جهد البلاء ودرك الشقاء وسوء القضاء والسمطة الأعداء. اللهم إني أسألك الهدى والتقى والعفاف والغنى. يا حي يا قيوم برحمتك أستغيث أصلح لي شأني كله ولا تكلني إلى نفسي طرفة عين. ربنا اغفر لنا ذنوبنا وإسرافنا في أمرنا وثبت أقدامنا وانصرنا على القوم الكافرين. ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. والحمد لله رب العالمين. Demikian, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ladies and gentlemen, that's the opening ceremony this webinar. The agenda will be continued with presentation from the speakers. May I have your attention, please? Now we come to our main session is presentation from the speakers. Presentation and discussion will be conducted by Nurse Eric Franada, MSN, as a moderator. Mr. Eric is awardee of Taiwan Scholarship of Master and PhD program, and he also has publication in Indonesia and Taiwan. Now he is a lecturer of UNIMUS and PhD candidate from National Taipei University of Nursing and Health Sciences, Taiwan. And he has quote is, "Everyone can do everything." Mr. Eric, time is yours.
All right, thank you so much, Bu Dewi, for the introduction, brief introduction of my personal information. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Dean of the Vice Dean of the Nursing and Health Sciences Faculty, and the Head of Nursing Department, and all of the audience for today's activity. Alhamdulillahi Rabbil Alamin, Ar-Rahmanir Rahim, Maliki Yawmiddin, Iyyaka na'budu wa iyyaka nasta'in, Ihdinas Shiratal Mustaqim, Shiratal Ladzina An'amta 'alaihim, Ghairil Maghdubi 'alaihim Waladdallin. Amin. Thank you for joining us for today's International Nursing Virtual Seminar. My name is Arik Franada, and I will be responsible for moderating today's virtual activity. In this occasion, we will have 3 speakers from Indonesia and Taiwan, and I'm glad to welcome all of 3 excellent speakers who will share us about the effective publication strategies at the international reputable scientific journal. We are all completely agree that today's seminar topic is very important for us as a lecturer, students, and clinical professionals to develop further scientific publication in the international scopes. And before we get started to the presentation, I have few housekeeping notes. Let me share my screen. All right. Today's virtual seminar is being recorded to be available for viewing post-seminar. And each speaker will have a total 45 to 50 minutes for their presentation, then followed by 10 until 15 minutes question and answer session, and after the presentation ended. And for all of the audience, if you have any questions for the speakers, I suggest you to type your questions to the chat box feature in your Zoom control panel, and I will choose 3 selected questions and read them to the speaker to answer after the presentation ended. Since our participants in this virtual seminar are mostly from Indonesia, So it's fine for you. Feel free to type your question in bahasa Indonesia and I'll translate it to English. Jadi nanti jangan khawatir ya. Jadi kalau misalnya malu atau ragu untuk menuliskan pertanyaan dalam bahasa Inggris, silahkan nanti teman-teman audiens bisa menuliskan pertanyaan dalam bahasa Indonesia and for sure I will help you to translate it in English. And the last one, if you have any technical questions, please reach me out directly via the chat function and our technical team will be assisting you shortly. All right. To begin this keynote speech session, let's invite our first speaker, Mr. Satria Pranata. Hello, good morning, Mr. Satria Pranata. Are you connected with us already?
Moderator. Yeah.
All right.
It's clear here.
Okay, can you hear my voice clear?
Yeah.
Okay, how are you doing?
Great.
All right, nice. So are you ready to share with all of our audience about your maybe your experience or your expertise about how to publish or how to write down the good method in research nursing? Ready, right?
Yeah, okay.
All right. Before we start listening to Mr. Pranata's presentations, I will briefly introduce him to all of you. Let me share the screen for you again. All right, you can see in the screen, Mr. Satria Pranata is a very productive nursing lecturer, author, and researcher. In this year of 2021, I guess he has published 7 international and 3 national journals. And currently, he is working on his long series of dissertation project with a multi-method research for his doctoral nursing program. This takes time, really tough. And one of the research methods will be shared to us today. And for more information about his biography and presentation file, you can go to our seminar website and you can download it as you desire. As a simple reminder, please type your question you would like to ask to the speaker in the chat box of your Zoom applications, and I will read it after the presentation is over. All right, I will now turn the time and screen over to Mr. Satria Pranata to begin the presentations about exploring nursing research using the Delphi method. You will have about 45 to 50 minutes, I guess, to deliver your presentation. I will notify you if the time is over. Okay, time is yours.
Okay. Thank you very much, moderator. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, let me share my screen first. Is my voice clear?
Clear, Mr.
Okay. Yeah, thank you very much. My great honor to Dr. Mubin, my great honor to speaker, Professor Yu and Professor Nur Salam, moderator and MC, and also audience for international webinar and article clinic. Thank you very much to give me chance to present my part about the opportunity to explore research in the nursing field of the Delphi technique. Well, talk about the Delphi technique, actually, this terminology not really popular in nursing field in Indonesia. However, if we want to try to type this terminology on the international database, we can find a lot of study about Delphi technique in nursing field. How it coming from the other scholar from the other country. Before I talk more about Delphi technique or Delphi study, I will start my presentation with this picture first. I believe majority of us well know about this picture. This picture show about the hierarchy of evidence-based. Peak of pyramid for systematic review, meta-analysis of randomized control trial. Then below randomized control, single randomized control trial, then quasi-experiment, qualitative study, a descriptive study, and the bottom part for expert opinion. It's easy to find study about the systematic review, meta-analysis, even RCT, quasi-experiment, qualitative study, descriptive study in nursing field in Indonesia or national database in Indonesia, but not easy to find study about DLP study or expert opinion in Indonesia or database in Indonesia. If we only collect one expert opinion, we cannot really believe it because only one expert opinion, and we cannot talk to other. It is consensus from many experts. We cannot talk to other like that. So the big question, so if we can collect many expert opinion, then we integrate many expert opinion, become a beautiful study. It might valid and reliable before to apply in the clinical practice in nursing field. So the big questions, the big question, how to integrate many expert opinion become strong study, like I talked before. So that's why the Delphi technique can be one of the best ways to explore study in this case. Delphi study, Delphi method, Delphi technique are same. It was first developed in 1950 by Norman Delphi and Olaf Helmer. Both of this scholar think about the how to avoid direct confrontation between experts if they want to invite many experts and ask them opinion. So they think about the anonymity. They believe anonymity can be avoided direct confrontation and also repercussion for expert opinion, many expert opinion. That's why Delphi technique discover, develop, and exist until today. Majority of publication about the Delphi technique in nursing field so far are study on determining the competency of field of expertise. For example, what kind of competency of nurse who work at the palliative care, competency of nurse who work at medical surgical, competency of nurse manager. We can explore what kind of competency by Delphi technique. This is majority of publication in the past, but recently this method was involved. Many scholars has used this method to explore more about the new concept, to explore more about the what definition of new concept, what strategy of new concept. Like me, I study about the precision healthcare. Just less people know about the precision healthcare for diabetes in diabetes population. I mean, so I and my team in Taiwan try to develop this concept and try to build strategy how to apply this concept in diabetes population in Indonesia.
I made a mistake.
I developed this concept in Taiwan first, then I bring this concept to Indonesia. In Indonesia, I discuss with expert by Delphi technique or Delphi study in Indonesia. After I discuss with expert in Indonesia, I revise some part of concept. Then before to apply in Indonesian population. So after I discuss with expert in Indonesia, I can talk that this concept appropriate for Indonesian population or diabetes Indonesian population. Just simple like that. Characteristic of Delphi study were first characteristic were round series. Round series like this. First round, second round, third round, fourth round, fifth round. Depend on our study. Some study maybe need 4 rounds. Some study maybe need 5 rounds, 6 rounds.
Thank you so much for your help,
our
Professor.
study.
Because now is
as general, 3 rounds is quite enough for Delphi study.
Yeah. Satria is delivering.
In the first round,
the Delphi
maybe we can invite 4 experts. Just for example, okay? 4 experts. Second round, maybe we will invite 5 experts. 5 experts in the second round can read the final wording or final item wording in the first round. They can read, but they don't know each other. It's called anonymously or anonymity. Anonymity avoid any bias and direct
Yeah, sure.
confrontation.
Thank you so much.
Participants
so
or
much.
experts are
Okay.
able to see the result of previous round. This is the
All right.
characteristic
Okay.
of
Thank you so much,
Delphi
Dr. Liu.
study.
Bye.
The other question, how to implement Delphi technique or Delphi study in the nursing field. I will show you my study because it's easy for me to give the example and give the explanation about the study or Delphi study or Delphi technique. Firstly, actually the
Aman,
Delphi
Bu Dewi,
study
beliaunya
is
mau maju.
just small part of big study.
Ya udah.
I request again. I
Saya
rewind
udah
again.
dikenal,
Delphi
kadang-kadang
study
saya
just
jet lag
small
40
part
tuh,
of a big study. Every
Yes,
study,
it
of
was.
course, need to
Yes.
do literature review
Yes,
first.
yes.
It's same with Delphi study. I developed the one concept, the new concept about the precision healthcare by literature review. I try to discover what definition, what development of precision healthcare, what the strategy, how to apply strategy for diabetes for precision healthcare. After I finish the development process with team in Taiwan, I bring this concept to Indonesia and did discussion with expert Indonesia by Delphi study. After discuss with expert, I revise again some part of strategy of precision healthcare, then try to test this strategy to the small sample by pilot study. After finish the pilot study, maybe we will face some difficulty in the pilot study process. Then we try to revise again before to apply or to implement in the big sample by randomized control trial. Then we also can evaluate the implementation of intervention by long-term implementation. Okay, this is the example how to apply Delphi study in nursing field in our study. The other question, how about the criteria of expert? How many experts we need to invite in our study, our Delphi study? Some study mentioned that at least we need 3 experts as large as 80 experts in our study or Delphi study. At least 3, but large as 80 is okay. But we have to recognize that there is no strict rule on the sample size for the data collection in Delphi technique. But we need to recognize also the selecting exactly expert is the most important procedure following to Delphi process because it will be affecting to the quality of result. What the consequence if we selecting wrong expert? The consequence is in the last result of our study. I will explain in the last page of my presentation today. Okay. Next to the this is the flow chart of Delphi study. Obviously, all of us hope our study, our manuscript, or our manuscript will be published in the international journal with high reputation. Yeah, and majority of reviewer or journal editor in international journal always suggest researchers to explain the study process by flowchart because the flowchart can make reader easy to understand the process of our study. Just the example for procedure of flowchart. If we want to conduct study by Delphi study, firstly by pre-meeting. We need to explain the process in the pre-meeting. Activity in the pre-meeting, our outline area of discussion. We constructing and identifying our thing related with our study first, then sending letter to expert in the Delphi study. In the sending letter, we need to explain the study process and how many estimate time commitment for participation. After we get the expert, then we go to the next round. In the first round, we need to explain how many days, how to collect expert opinion, either face to face or by questionnaire. We need to explain clearly in the first round. How many expert, focus discussion on what, we also need to explain in the first round. The response that were mentioned by expert in the first round form the basis of study before to the next step on the second round. After finish we summary the first round, we go to the second round. In the second round, we also need to explain how many days we discuss with expert in the second round. Then we will do a rediscussion with additional expert about what. Maybe first round we discuss with 4 expert. Second round we discuss with 5 expert, but 5 expert can read the summary from the first round. After we discuss again, rediscussion again with expert in the second round, then we write down the summary, then formulate in the form of result or final wording before we go to the next step or go to the third round or the final round. In the final round, we also need to explain again how many days in the final round. And we will ask all experts from the first round and the second round in the final round. We ask them and they need to answer, they agree or disagree for the final wording we did. How many experts agree? How many experts disagree? We need to count in the presentation. Maybe at least 80% expert need to agree with the final wording. If less than 80%, maybe we did some mistake in our study process. So that is like I talked before, try to choose exactly expert in our study. If we choose the wrong expert, maybe the result will be questionable. Okay, all experts will be asked to strongly disagree or strongly agree with the final wording of an item, as well as provide additional comment if needed. And after a 3-round finish, finally we can talk that consensus was reached after we discuss with expert in Indonesia. Strength and weakness of Delphi study. Delphi study for strength were flexible, and anonymity can reduce the risk of halo effect. But the weakness, this study quite complex and time consuming, and multiple rounds can lead to high dropout. And also participants can change their response after few other views. But the high dropout and participants change their response can be avoided with if we collect exactly expert. Yeah. The summary of my presentation today. However, we can reach consensus from Delphi technique, but we still should consider whether our research question can be answered through the expert consensus or other approach. Maybe by randomized control trial, quasi-experiment, qualitative study. Okay, try to identify our study first. Then try to find a strong team for the study to give a big impact on the nursing field. And the last note from my presentation today, the Delphi technique is credible research methodology. Hopefully, after this webinar, after this article clinic, we can try to use this methodology in our study in nursing field, because there are so big opportunity for us to publish this research methodology. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Okay, Waalaikumsalam warahmatullahi wabarakatuh. Right, quite short and clear, I think. And thank you very much, Mr. Satria Pranata, for your excellent and interesting talk. And I have 2 questions already in my hand. It's from our faculty lecturer from Muhammadiyah University of Semarang that texts me directly to WhatsApp chat, and I need me to ask you, right?
Yeah.
So welcome to the discussion session, and yeah, we can talk freely in this discussion session, right, Mr. Satria? Yeah, it's maybe you can talk more about your experience during conducting, because you was conducting the Delphi method before, right? Yeah, okay. The first questions is come from Mr. Arifianto from Nursing Faculty of Muhammadiyah University of Semarang. He is asking about how is the acceptance rate for the publications, especially in the International Nursing Journal if we conduct the Delphi method. And the second one is the question from Mrs. Mahmudah from nursing staff also. Actually, she is the head of nursing department. She is asking about how is the minimum expert degree required to be a reviewer. Since we all know it's very difficult to find expert lecture in Indonesia, right? If you study in Taiwan or wherever is it, I think it's really easy to find it. But how about in Indonesia? That's two questions. And please give us further explanation. Thank you.
Thank you, moderator. For acceptance rate, I think for acceptance rates, it depends on our study.
Okay.
Based on my experience course, if we can provide beautiful result of study and we can provide interesting part of our study, it's easy for us to publish in international journal, nursing field. But don't forget, before we submit in international journal, try to choose the right translator,
okay.
Because majority of international journal always ask about that. The quality of language is not good. Majority of international journal always talk like that. So try to choose the right translator and also provide interesting title, interesting part in our study is very useful to publish international journal. That for the first question. And the second question, I also face this problem. It's not easy to find expert in Indonesia. So, but if we have a lot of connected, okay, lot of connected, like me, I'm focused on diabetes, patient with diabetes. I'm focused on research in diabetes. I know who is expert in diabetes in doctor.
All right.
In Semarang, in Jogja, in Kalimantan or Borneo, in other country, in Indonesia, I know who is expert. Even it from physician, even it from nurse, even it from dietitian. I try to build a relationship with them. Okay, so maybe sometime if I conduct a study about the Delphi technique, it's easy for me to call them one by one, to invite them, included, become expert in our study. Okay.
All right. Back to the first questions. If we need to compare to other methods like the quantitative study, qualitative study, how is the trend is right now for the Delphi method to be published? Is that the higher or lower? Based on your experience, based on your reading, or
actually,
it still depend on the topic.
Yeah, still depend on the topic, but actually, based on my experience before, I just submit one time, and it accepted in SSCI journal with high impact journal.
Oh, that's great.
Yeah, just one submit. But before we get the beautiful study, of course we need to have a strong team in our study.
Okay, good. Right. I think we still have like 7 minutes left for the discussion, and I received 2 more questions from Domingos from Airlangga University, and also Theresia from Universitas Pelita Harapan. And Mr. Domingos asking about how is the progress of Delphi method in nursing study in Indonesia, in Taiwan right now. I mean, I think he is asking about how is the rate, like in Taiwan is higher or in Indonesia is still lower. How is the progress? And Miss Theresia asking about what are the requirement of each expert? The degree, I think maybe master, it's acceptable, or bachelor is acceptable, or the expert that need minimum 10 years required, 10 years experience in that field, something like that. Yeah, please.
Okay, I will ask the first question first. The
Mr.
question about how the progress Delphi method in nursing study in Indonesia and Taiwan right now. In Taiwan, I think is quite a lot of researcher try to use this methodology, but in Indonesia, I have tried to search or research about the Delphi study in Indonesia, but maybe I cannot find. Yeah, in Indonesia. So that's why I talked before. It's a big opportunity for us to try to write down with our study and try to publish our study in the international journal. We have big opportunity for this because just less people discuss about Delphi study in nursing field. And the other question from my friend Teresia. Yeah, Teresia. Teresia asked about the requirement of each expert is depend on our study. We need to learn one by one of expert first. We need to review their publication first. Like me, if I want to choose the expert about the precision healthcare, we need to read the publication of expert one by one. Oh, Mr. Arit, he has publication good in the self-management, good in patient preference, good in big data, so I can invite Mr. Arit. Just like that. And also need to I also collect expert from hospital. I choose the master degree and has a lot of experience in their expertise. Yeah, depend on our study.
Okay, and still have a time. I think for 4 minutes left, and this I think it's interesting for us as a researcher to conduct the Delphi method. I will add one more questions. It for myself. It's if we would like to conduct a Delphi method in Indonesia, for example, like you were doing right now, is that possible if we invite the expert from another country, for example, from Taiwan, from another country like in US or something like that? Is that possible, or we need to if we conduct research in Indonesia, we need to invite the expert only from Indonesia?
Your question is same with my question to expert in Taiwan. I asked the same question to expert in Taiwan also.
All right.
They talked before. We also can invite other expert from the other country. If you want to reach more big consensus from expert from the other country, it's okay.
But the other maybe limitation or difficulties is the barrier language. Maybe you will need a lot of time to transcribe and to translate the language, because not every expert can like expert in English or can speak Bahasa Indonesia or Chinese maybe.
Yeah.
All right.
And the interesting majority of experts from the other country always provide more time to answer our question.
Okay.
And
right.
She can explain detail and more explanation than the other experts, especially from the expert from the developed country.
Okay. Could you please turn off your share screen, Mr. Satria?
Okay.
Okay. All right. So, ladies and gentlemen, due to time limitation, I apologize that if you still have several questions, we are not available to answer it right away. But you still can connect with the speaker, Mr. Satria Pranata, one-on-one through a private message or email. Well, I think time is over for this first session. Thank you again for Mr. Satria Pranata. It was a pleasure to have you in this seminar today. Thanks for answering all of questions and thanks for the great presentation. Please give warm applause to Mr. Satria Pranata.
Very much.
Thank you so much. You need anything to be said? No? Okay.
No, thank you.
All right. Now, without further ado, we will turn to the time over to the next speaker. I'm glad to invite Professor Che-Hyu Liu from Taiwan. Hello, good morning, Dr. Liu. Are you with me right now? It's not? Okay, wait a minute. I will try to notify him. I'm still trying to connect with Dr. Liu and hello, Dr. Liu. Have you signed in already? Wait a second. Let me find him. Wait, how? Dr. Liu? Yeah, it's your time. It's yeah, yeah. Yeah, sure. Thank you. Okay. Yeah, he is now still. Hello, Dr. Liu. Can you hear my voice clearly? Oh, you're still mute. All right.
Okay. Now, can you hear my voice?
Sure, absolutely. It's clear.
Clear, right?
Yeah, sure. All right. Good morning, Dr. Liu.
Yeah, good morning, Eric.
How are you today? Long time no see.
Yeah, long time no see. Okay.
Okay, first of all, thank you so much for your time and your willingness to attend to our invitation as one of distinguished distinguished guest speaker. All right, Dr. Liu, before we start listening your presentation, I will let the audience know about your brief information. Let me share the screen for the introduction first. All right. All of you can see the screens. This is the brief information of Dr. Liu. Professor Liu is a nursing and healthcare management professor at National Taiwan University of Nursing and Health Sciences. He is well recognized as biostatistician consultant and remarkable author and researcher. He had written and published more than 150 papers in the International High Impact Journal and received a lot of extraordinary international awards. Currently, he is also noted as a reviewer in the top international journal. So he is the one actually who really understand about the trend of the international nursing publication as well. So that's why we are asking Dr. Liu to share his experience and his knowledge about nursing trends to our friends in Indonesia. And before we start listening Dr. Liu's presentation again, please go to our website for more information about the Dr. Liu's biography and his presentation files. And please be sure to type your questions into the chat box in your Zoom application. It's in Bahasa Indonesia or English is okay. I will help you to translate it later. All right, I will now turn the screen over to Professor Liu to begin the presentation about current international nursing research and publication trends. You will have about 45 until 50 minutes, and we will follow by 10 minutes discussion. Okay, time is yours.
Okay. Okay. So now I'm going to share my screen with the audience.
Sure.
Okay, can you see my screen now?
Right, yeah, it's clear.
Okay. Okay. Many thanks to Eric's introduction. Okay, I'm really happy to see Eric and Satria. Okay, through the internet. Okay, hope you guys are well. Okay, and it's my pleasure to share my experience about the current international nursing research and the publication chain. Okay, and because I have only about 40 to 45 minutes, okay, I will keep my talk in simple. And this is the outline of today's talk. Okay, I will share some trends in nursing research and some suggestions for nursing researchers in Indonesia and some publication suggestions. Okay, and okay, last year there is a paper. Okay, maybe I can start from the paper. Okay, the title of the paper is The Current Trends in Nursing Research Across 5 Locations. Actually, this is an expert panel. Okay, and they invite several scholars. Okay, several leaders. Okay, 7 leaders from 5 countries, and they participated in a discussion panel and a series of workshops and conference presentation, and they use all the conference presentation and their discussion in the expert panel. They recorded it and they use content analysis to write this paper. Okay, actually this is a report of I remember there was a 3 days conference. Okay, and they have some finding. Okay, maybe these 7 points and can give you some inspiration of your study in the future. Okay, first of all, we need to take into account the change of the demographic alteration, such as in Asian countries. Guys, you know, the birth rate is decreasing in many countries, and the whole society become aging than before. Okay, so here is a chain of changing of the nursing research. Okay, and secondly, we need to take into account the diversity and the globalization. Okay, there is a very good example is the COVID-19. Okay, the COVID-19 study is we cannot limit our study in only one country. Okay, we need to take into account your neighborhood country. Okay, your neighborhood country. Okay, and the third is the technology innovation. I will suggest to my student, okay, now if you are going to design or propose a new nursing intervention, I would strongly suggest them to use some, okay, technology, or if possible, I would encourage my student to tape a video, okay, and how to do the exercise and how to introduce your study, and okay, if you have some spatial technique, okay, or some spatial suggestion for your patient, okay, I will strongly suggest my student, okay, to tape a video and upload to the YouTube, and you will have a QR code, and you can share the QR code to your participant. Okay. Next is the individualized care. Okay, individualized or personal care, and the population health initiative. Okay. Now here, okay, we can see there is a term change in recent decade. In the past past decade, people like to say public health. Okay, and the nursing researcher, sometimes you guys will think, okay, maybe okay, the so-called public health research is irrelevant to nursing research. There is a pretty long distance from the nursing research to the public health research. And then now there is a change, more and more publication, more and more textbook and the journal. They like to use the term population health, okay, which is a pretty broad discipline, okay, pretty broad discipline. Okay, we need, okay, like the last two points, okay, we need more interdisciplinary collaboration, okay, and to do the so-called population health, okay, population health, okay. Also, okay, the policy, okay, the policy, health policy and the regulation, okay, and this is another aspect of the nursing research, okay. And the last is the nursing workforce change, okay, nursing workforce change. Nursing workforce change, okay, such as in Taiwan, okay, if we are going to improve the care quality, okay, we need to arrange more nursing workforce, okay, in one unit, okay, because in Taiwan, okay, one nurse need to care, okay, many patients. The average I remember is 12, okay, in the day shift, okay, and maybe in the night shift, one nurse need to care 16, okay, 16 patients, okay. So we need to lower down, okay, the ratio, okay, we need to lower down the ratio, okay. And in this paper, they also propose some future direction of nursing research across the globe. Okay, first is the cost effectiveness research, the CEA. Okay, and the second is the implementation science, and the third is the data science, and the number 4 is training the future generation of nurse researchers. And the next is the population health, and the last is the team science. Okay, among, okay, these 6 points, okay, maybe due to the time limit, I just can introduce the A and C, cost effectiveness research and the data science. Okay, and maybe, okay, not everyone, okay, know what is the so-called cost effectiveness research. Okay, I have example. Okay, a CEA. Okay, actually, this is not a real CEA research. However, this can give you some basic idea of the so-called CEA. Okay, of the CEA study. Okay. The study title is the comparative efficacy of the 96-hour and the 72-hour replacement of the cycle of replacement of peripheral intravenous catheters. Okay, they use a randomized control trial. Okay, the story is very simple. Okay, the story is very simple. Okay, and the peripheral IV injection. Okay, everybody know it. It's a common clinical procedure. However, according to United States CDC guideline, there is no need to replace the peripheral catheters routinely every 3 days. In Taiwan, okay, we use this guideline. Okay, however, okay, the local evidence, okay, the local which imply in Taiwan, okay, local evidence-based research, okay, is very rare, okay. So they conducted the study, okay, to determine whether these guidelines are appropriate for Taiwan, okay. So based on the background, okay, guys, you can think about it. You have lots of stimulation in Indonesia, okay. Maybe, okay, some guideline or the current guideline is like the current version. If you are going to improve the routine, okay, you can try to propose some study. Okay, you can try to propose some study. And this study is very special, okay, because in most research, okay, while we are going to do the statistical analysis, we all expect they may have the statistically significant difference. However, for such study, okay, there is a very special expectation. Okay, maybe, okay, we will not expect they will have statistically significant difference. Okay, so the study explores the effect of routine replacement of the peripheral IV catheters every 96 hours versus every 72 hours. Okay. And they use RCT method, and they recruit 142, and every group, okay, have 71 participants. Okay, the two groups is 96 4 days replace the IV catheter, and the other is the routine 3 days. Okay, 72-hour group. Okay, and they use the chi-square test and the dependency test. Okay, to compare the difference in the previous, okay, in the previous and the injection site infection and the bloodstream infection and the catheter occlusion, okay, as well as the material cost and the nursing hour per patient day between these two groups, okay. And the results, okay, there is no significant difference between, okay, these two groups respected to the incidence of previous and injection site infection and the bloodstream infection and the catheter occlusion. Okay, not significant difference. However, for the cost, okay, okay, they the 96-hour 4 days replacement group, okay, has a significant material, okay, medical material cost reduction, and a significant reduction of the nursing hours per patient day. Okay, although, okay, the unit is by seconds. Okay, every time I share the paper to my student, okay, only save 3 minutes. Okay. However, okay, this is an example of the so-called cost effectiveness analysis in nursing research. Okay, so what is their conclusion? The replacement interval, okay, for peripheral IV catheters can be considered, okay, to 4 days, okay, instead of the 3 days. Okay. And the next example, okay, the next example is the data science. Okay, data science. Okay, this is also a paper published this year. Okay, now the IJNS, okay, International Journal of Nursing Studies, okay, is the top 1 journal in nursing research. Okay, maybe we can have a look, okay, of the paper. Okay, what is the meaning? Okay, the so-called data sciences. Okay, it's just an example. Okay, it's just an example. Okay, Okay, the study title is Exploring Omission in Nursing Care. Okay, they use a retrospective chart review. And this is an observational study. Okay, actually, okay, if you have the chance to download the paper, the study is very simple. Okay, the study is very simple. Why a simple study can be published in the top 1 journal in nursing research? It's very interesting. Okay, okay, and let's go to the. Sorry, okay, I just have a screenshot of the abstract. Okay, I just highlight some points. Okay, and first of all, okay, the design. Okay, the design is observational single center, single hospital. Okay, only one hospital. Okay, in 2 German neurological inpatient units, and a random sample of 100 patient admission. Okay, 100 patient admission. But how about the amount of the data? Okay, you can see they use a so-called structured chart review protocol. Okay, if you are going to study the hospital chart review database, you still need to design a protocol. Okay, as if okay you are going to do the face-to-face interview. Okay, and the next, okay, 100 patient, and how about their data amount? Okay, 1,885 activities. Okay, and they analyze. Okay, they just use observational study. They analyze the nursing activities. Okay, what kinds of nursing activities are easily omitted? Okay, omitted. Okay, so of the review activities, okay, 52% were fully or partially omitted. Okay, so okay, so you can see actually the story of the paper is very simple. Okay, and for one inpatient patient, okay, one nurse need to do okay many like a checklist. Okay, however, based on their chart review study, they found okay some nursing activities were omitted. Okay, and next we can see the highest, the most frequently omitted nursing activity was giving emotional care. Maybe, okay, I'm not sure for every one of you. If giving emotional care, okay, will you give emotional care for every inpatient? Okay, and additionally, okay, the conclusion. This is the first time. Okay, this is the first. They call themselves. Okay, they call themselves. Okay, patient level data on a broad range of activities have been analyzed. Okay, so I need to ask you. Okay, if you have the chance, you can download the paper. Did they use the sophisticated statistical analysis? No. Okay, so what is the important point of the paper? Okay, what is the important point of the paper? Is the research idea, okay, omission of nursing care activities. Okay, and they use their hospital chart review data set. Okay, and how about the sample size? Okay, apparently you can see only 100 patients. However, how many the data set? How many the data? Okay, 1,000, more than 1,800. Okay, so simple story, huge data set. What kinds of story you can tell? Okay, so if you are going to do an interesting research, okay, the very important is your research idea. Okay, it's the research idea. Okay, so I brief this study. Okay, randomly select okay only 100 patients, and they have 1,885 nursing activities, and analyze if all the nursing activities were really implemented. Okay, that is the story. Okay, I think this study is very interesting, and the guys in Indonesia, okay, I believe, okay, you guys can do the similar, okay, can do the similar study also, okay. So, okay, I have some suggestion, okay, for the chart review study, okay. First of all, okay, the characteristic of the hospital chart review study, okay, you must have a huge data set. Secondly, your data must be complicated. And the last, okay, I need to tell you, okay, you will have lots of missing data. So I use this as an example, okay, to inspire you, okay, to learn, okay, the technique of the so-called data science. This is not statistical analysis. This is the data science. You need to have, you need to learn, okay, more technique, okay, about the data processing. And I have some suggestion to you, okay. If you are going to do the chart review study, okay, you still need to design a case report form as if you are going to do the face-to-face interview survey, okay, and which will help you to enter your data easier, okay. And secondly, okay, maybe, okay, you need to recall the demographic information as detailed as possible, okay. Also for the disease related and the treatment related variable, okay, if you use the hospital chart review database, okay, I believe, okay, in your hospital you work, okay, the hospital chart review database, okay, will include such information. And besides, okay, there is a very good advantage of the chart review study is the follow-up information, okay. What is the meaning of the follow-up information? Okay, you can see my last point. Okay, the outcome variable need to be defined well. Okay, such as there are many studies talk about the readmission in 14 days after discharge, or somebody will call it abnormal readmission. Okay, and if you use the hospital chart review study, okay, it is very good study resources, or get infection or not, or fall or not, okay. However, I need to tell you, okay, if you are going to use the chart review study, okay, in most the hospital, I believe, okay, no matter in Taiwan or in Indonesia, okay, we do not have the scale or inventory data, okay. So if you are going to study, okay, quality of life, self-efficacy, okay, it is impossible to use the chart review study. However, you can combine, okay, okay, these two data, okay. If you can identify a group of patients, of course, you can survey their quality of life or self-efficacy or some other psychological inventory or scales, and in companion with their chart review database. And this is also a very good study design, okay. And for data science, you need to learn more, okay, not only how to use the statistical software such as SPSS, but also you need to learn more technique about the data processing, okay, because you need to you need to process, you need to deal with the complicated data set into the data set you can study, okay. It's a pretty long way, okay, it's a pretty long way, okay. Maybe you need to learn some SAS or such as R, okay, and more and more free resources, okay, you can search in website, okay. So in brief, actually, okay, I call it secondary database, including hospital chart review database or nationwide survey. And I believe you have some study topic in your mind or some expected study title, okay? But actually, I need to tell you, okay, there is a gap, okay? There is a gap, okay? Not every study topic can be studied using the hospital chart review database, okay? And you need to think about it, okay? If you can access the hospital chart review database, okay, you need to think about it, what kinds of study topic you can do, okay, you can do, okay. And next, I move to the suggestion for nursing researchers in Indonesia and some publication suggestion, okay. And here I propose some points you guys need to take into account, okay. And first, okay, is the research idea. Okay, research idea. Okay, maybe today, okay, the example study I show you, okay, is not so typical. Okay, it's not so typical. Okay, but very special, and I believe you can do it in Indonesia also. Okay. Secondly, okay, resources. Okay, resources is very important. Okay, resources is very, very important. Okay, including the budget. Okay, if you are going to do one research by yourself, okay, you will be exhausted. Okay, you will be exhausted. Okay, and maybe if you can have some budget, okay, you can hire some research assistant, okay, to help you to collect the data. Okay, maybe it will be easier for you. Okay. Second is the time. Okay. Actually, I will suggest to my student. Okay. Once you have a study topic and you have the budget, you need to determine a time. Okay. I need to share many students' experience. Okay. If you are determined to finish a study in 1 year, okay, you will be very aggressive. If you give you, okay, 2 years or 3 years, okay, unless this is a very, very big study, you have step 1, step 2, step 3. Okay, if a simple study, you need to plan, okay, 2 years or 3 years, okay. I need to tell you, okay, maybe 2 years later, 3 years later, you will hardly forget, okay, what you think, okay, at the beginning stage, okay. The next is the human resources, okay. Human resources is including, okay, if you have the research assistant or you have colleagues, okay. And the next point is also very important, collaboration network. I encourage you to establish your collaboration network, okay. And the next I need to mention, okay, the study design, okay, because study design, okay, relates to the resources you need to pay, okay, you need to pay, okay. Due to the time limit, I just mentioned the term, okay, such as experimental study, case control study, or cross-sectional study, okay. And the next point is the sample size, okay. Before I start today's lecture, okay, I revised my PPT again, okay, at my waiting time, waiting for Eric call, okay, I revised, just add some more words, okay. I find there is a change in global nursing research, okay, the sample size become bigger and bigger, okay, no matter for United States, European countries, okay, also in Taiwan, I need to mention, okay, more and more studies published by China, okay, nursing researchers, especially study coming from China, okay. Their paper, okay, there is a very, very important characteristic of the paper coming from China is big sample size. And in Indonesia, if you can have enough budget and you set a time, okay, not too long, and you have good human resources, and if you have a good collaboration network, I believe, okay, study, okay, coming from Indonesia also can have a big enough sample size, not like in Taiwan, okay. In Taiwan, okay, it will be very difficult to nursing researcher in Taiwan to have a big sample size study, okay. And the last is the measurement instrument, okay. And yeah, okay, according to my teaching experience, okay, every time when I look at the study, the students study, okay, student, okay, actually, when they translate some English version scale into Bahasa version, actually, okay, it is worse, okay, to write it, to do it well, okay, and it has words of publication, okay, and I did some work, okay. I just searched in PubMed by using the keyword reliability, validity, Indonesia, okay. You can see there is a chain, okay, and after year 2000, okay, more and more publication, okay, coming from Indonesia. But when I look into detail of the studies, okay, not all, okay, not all relates to nursing research. Some of the research, okay, is the medical technology or some biotechnology technique, okay, applied in Indonesia, okay. However, I need to tell you, one high quality nursing research, okay, you need to have a good measurement instrument, okay. So my suggestion is translation or development of measurement instrument are very important for nowadays Indonesia nursing research. And it works, okay, it works, you guys, okay, to do, okay, such kinds of studies, so that, okay, you the younger generation of nursing researcher in Indonesia, they can use, okay, your work, okay, to advance their study. And okay, here I just use some example paper, okay, some example paper, okay. And here we can see, okay, this is a paper published last year, okay, psychometric testing of an Indonesia version diabetes self-management instrument, okay. I believe it is also an international study in TMU, okay, in Taipei Medical University, okay. And her advisor is Ji Min-chen, okay. And okay, I need to, okay, just give you some simple introduction, okay. If you are going to do such kinds of study, okay, you need to learn, okay, you need to learn some psychometric theory, and you need to learn some statistical technique, okay, including the exploratory factor analysis and the confirmatory factor analysis and the item analysis, and also the item response theory, such as Rush model. Okay, we need to know, okay, if the translated version is difficult, okay, for participant or suitable for participant. Okay, this is the so-called Rush model. Okay, and I believe in Indonesia, okay, you have many, okay, chance, okay, have many chance, okay, to do such kinds of translation and even develop, okay, because if you find, okay, the existed measurement instrument, okay, the existed scales, okay, even commonly used in United States or European countries. And you found it is not so suitable or feasible in Indonesia based on the social cultural difference. Okay, I encourage you to develop, okay, the Indonesia version. Okay, and here I need to share some interesting finding with you. Okay, usually when I talk about, okay, the version, okay, I will say Bahasa version. Okay, because I have told lots of Indonesia students. However, in publication, okay, in papers, okay, authors like to use the Indonesian version instead of the Bahasa version. This is my finding. Okay, this is my finding. Okay, very interesting. Okay, and this is just a quick look. Okay, I found some questionnaire. Okay, published by Indonesia researcher. Okay, such as develop and the validation of the World Health WHO Disability Assessment Schedule version 2. Version 2. Okay, 2.0. Okay, Indonesia version in stroke survivor. Okay, maybe okay, some of you know the author. Okay, know the author. Okay, and this is coming from the rehabilitation. Okay, rehabilitation. Okay, and next, okay, if you are a beginner, you are a beginner of research, or if you have limited resources of research, even though okay, you can start from cross-sectional, okay, correlational study. Okay, I use some example paper published by our school's alumni. Okay, coming from Indonesia. Okay, the first okay is our student. Okay, Opia. Okay, I believe some of you okay know her. Okay, her study is actually okay. The story is very simple. Caring behavior perceived by nurse, patient, nursing student in Indonesia. In Opia's study, okay, her advisor is Tintin Lee. Okay, she just used the Pearson correlation coefficient. That is the most sophisticated statistical analysis in this paper. However, okay, her work, her master's thesis published in a pretty good journal, okay, Journal of Professional Nursing, okay, in year 2018. This is also a cross-sectional correlational study, okay. And the next is the Ashi, okay, Ashi, okay. And the study topic, okay, is very special. Disaster knowledge, skill, and the preparedness among nurses in Bengkulu, Indonesia. Okay, you can see. Okay, now, okay, such kind of study, okay, is very popular in nowadays nursing research. Okay, a descriptive correlational survey study. Okay, it is okay. Okay, published in the Journal of Emergency Nursing last year. Okay, it's also very good. Okay, it is also a very good study. Okay, and the next is coming from the psychiatric nursing. Okay, Leah. Okay, Leah. Okay, and her work okay was not published in nursing related journal, but also a very good journal. Okay, perspective in psychiatric care. Okay. Her study title is The Influence of Adherence to Psychotic Medication on the Quality of Life Among Patients with Schizophrenia in Indonesia. Okay, it is also a cross-sectional. Okay, so I give you the example paper. Okay, published by our school's student. Okay, they all use descriptive cross-sectional study design. Okay, and if you are just a beginner of the researcher, okay, maybe okay you can start from such kind of study design. Okay, And this is another study, okay, interventional study, okay, the effect of the prenatal gentle yoga on maternal-fetal attachment among first-time expectant mothers in Indonesia, okay, published by UNITA, okay, and the paper just published this year, okay. And this is a simple interventional study, okay, simple interventional study, okay. And the last part, okay, I can give you the advice, okay. We can talk about the new chain, okay. Maybe I can say this is a new chain, okay. It's the mediation and the moderation, okay. And this is the Professor Andrew Hayes, okay. Professor Andrew Hayes, okay. And he developed the SPSS add-on process, okay, and which is the more and more popular globally, okay, more and more popular globally, okay. If you have interest, you can go to visit his website, okay. And he also published the book, okay. This is the first edition. This is the second edition, okay. And okay, the first of all, okay, is the mediation and the moderation analysis, okay. And this is an example, okay. I select the paper, okay, who has the first author coming from Indonesia, okay. Mediating effect of hope, okay, on the relationship between depression and the recover in person with schizophrenia, okay. So I need to just give you a simple introduction of the so-called mediation, okay. What does it mean? Okay, actually they have depression here. Okay, this is we call it independent variable, okay. And here they have a recovery. Okay, we call it DV, okay. And if, okay, you can successfully resolve the depression in a short time, okay. So their research assumption is if a patient, they have severe depression and they are expected to have lower recovery. If in the short time you can resolve the depression, the depression disorder or depression symptom, okay, of course, okay, we can help them, okay, to improve their recovery. However, in the short run, okay, we to resolve the depression is not easy, okay. So they introduce, okay, a mediation variable called hope, okay, to investigate if the depression, okay, will also influence their hope, and the hope will also help improve the recovery, okay. However, we can propose the nursing intervention, okay, nursing intervention, okay, to improve hope, so we can further improve the recovery. Okay, so this is a simple mediation story. Okay, if you have any question, you can ask Eric and Satria. Okay, they have learned this, okay, already. Okay. Okay, and the next, okay, is the multi-mediator. Okay, multi-mediator. Okay, and strengths use and nurses depressive symptom, and the mediating role of basic psychological need and satisfaction. Okay, this is also, okay, this is extended version of the simple mediation study. Okay, this is also independent variables, chance use, and the depressive symptom. Okay, and they introduced two mediation variable. Okay, autonomy, satisfaction, and the relatedness satisfaction. Okay, and the detailed story. Okay, you can go to download the paper. Okay, and this is the newest trend. Okay, maybe. Okay, I can tell you. Okay, more and more
Advanced.
nursing research paper. Okay, they use the so-called moderated mediation model. Okay, this is a paper. Okay, just published this year. Okay, they call it the work horizon and presentism and the work family conflicts and the personal and the work outcome. Okay, and testing a moderated mediation model. Okay, so you can see how many variable. Okay, how many variable. Okay, they how many variable they take into account. Okay, first work horizon. Okay, presentism, work family conflicts, and the personal and the work outcome. So many variable they are going to deal with. Okay, so many variable they are going to deal with. Okay, so we can see that actually basically this is also a mediation model. Okay, this is also a mediation model. However, work horizon and the work horizon are pre-esteemed. Okay, this is the so-called moderation. Okay, what does it mean? Okay, the relationship between the pre-esteemed and the work family conflicts. Okay, the relationship you can regard it as a simple linear regression. Okay, simple linear regression. They have a coefficient. Okay, the coefficient will be different based on the score of the work horizon. Okay, the slope. Okay, they will have. If you use a process, you will have 3 slope. Okay, and the outcome we will have 3 line. Okay, we will have 3 line. Okay, and this is called moderated mediation model. Okay. Okay, so my talk is here. Okay, and I find the picture. Okay, I heard Eric graduate from our school. This is Dimas. Okay. Okay. Any question or comments?
All right, thank you so much, Dr. Liu. Can you stop your screen, please?
Yeah.
Yeah, I can. So I can see the participant who would like to ask the questions. All right. First of all, thank you so much, Dr. Liu, for the remarkable presentation. Now let's heading up to the question and answer session. And now I have received one questions. I think it's from our school, Professor Liu. It's from Teresia.
Teresia.
Yeah,
Okay.
Teresia.
She has come back to Indonesia.
I think it's not yet. Is it? It's still in Taiwan. I think this last month, the end of this month.
Okay.
All right. The questions is for those beginner researcher, what is your suggestion after they have a cross-sectional study and doing the translated instrument? Should they focus on continuing the experimental study with the big sample size? Thank you. So it means she emphasized she already conducted like the instrument development, and then what should she do after that? It just stop, or she isn't it to continue using that scale to be tested to the big sample? Is that, or doing the intervention research?
Okay, and for this question, should they focus on continue experimental study? And Teresia, you propose several questions. First of all, yeah, cross-sectional study, if possible, I encourage you to recruit as more as possible study case, And of course, okay, guys, you have learned the G power. Okay, G power just can give us a lower the minimum requirement of the study sample size. Of course, many journals now require the author to write the sample size determination section, especially such as JAN, Journal of Advanced Nursing. Okay, they insist researcher need to write the paragraph, okay, to tell, okay, how to determine the sample size you need. Okay, and if you have the resources, okay, to recruit, okay, big enough sample size, okay, such as some studies coming from mainland China, okay, they say they cross-sectional study, they recruit 1,000 case, okay. If you have the chance, if you have the resources to recruit, okay, more than 500, okay, okay, cases, okay, maybe, okay, you do not need to write how to determine, okay, maybe you just said that we just recruit, okay, what kinds of participant, okay, that is enough, okay. So if should we write the sample size determination depending on the resources you have, okay, and should they focus on continuing experimental study with big sample size? We can look at the question into two parts, okay. First, yes, I encourage you to study to develop the experimental study further, okay. However, if you are going to conduct the experimental study, okay, maybe, okay, you need to control your sample size, because for one experimental study, if you plan to a big sample size, okay, maybe, okay, for one researcher, okay, it is a very, very heavy burden, okay. So I would suggest you, okay, once you are going to do the experimental study, you had better use the software such as G-Power to help you to calculate the sample size you need, okay. Okay,
Alright.
Maurina.
Yeah, it's come from our alumni. She's back to her hometown right now, and I think she is working in the university or somewhere, and she is asking about some professor she met before. They suggest not to create the instrument. However, in the situation in Indonesia, as you know, we are very difficult to find like the Indonesian or Bahasa version that's suitable with our research design. So that's why we need to develop that one. So what is your suggestion based on
Okay.
that previous professor suggestion not to create or develop that instrument?
Okay, actually, okay, Eric Dimas, okay, you are a PhD program student, okay. Usually, I will talk in detail for the PhD student, okay. Guys, you should think about it. What is the spelling of the PhD?
Doctor of
Doctor of
Philosophy.
Philosophy.
Yeah.
Yeah, Doctor of Philosophy. Okay, so for master degree, for master program student, okay, I need to say sorry because usually for the master degree student, I usually encourage a student to use the existed instrument. Okay, but actually, okay, according to my teaching experience, I have taught the international student program for a pretty long time. Okay, every year when I look at, okay, when I know some Indonesia student, okay, they are going to do some study, and they translate their the English version questionnaire or scale into Bahasa version. Okay, I will worry about it. What is the reliability and the validity? Okay, and I do not agree with the comment coming from some professor. Okay, because you need to translate first. Okay, you need to translate the English version into Bahasa version first, and apply the Bahasa version scale to your participant. we need to get the answer. If this questionnaire or scale after translation into Bahasa version, if they have good validity or reliability, we need the answer. If we do not have the answer at the first translation, we cannot say, oh, it is suitable or it is not suitable. Once you translate the instrument into Indonesia version, okay, if it is good, why not? Okay, go ahead to use. If it does not have a good reliability and validity, even some items are not so suitable for Indonesia. Okay, so that we have some strategy. We may revise. You can propose a revise, just revise some terms, just rephrase some questions. But most of the question you still can follow, you still can use. We can propose a revised version. Okay, that is my suggestion. Okay.
All right, Professor Liu, I think because of limitation time, I'm so sorry about that. The third speaker is already here. Hello, Professor Nur Salam. Are you here, right? Already?
Yeah.
Okay.
Yeah. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Yeah, you will be the next speaker, so I will terminate this session first.
Okay.
I will turn to
if you have any question, you can email to me.
Yeah.
Okay. Or contact Eric. Okay, Eric will give me your question. Okay.
Okay, ladies and gentlemen, I think
Thank you, Prof.
Yeah, time is up for this session. I apologize once more for the several questions cannot be answered directly, but you, as the doctor, you say that you still can approach him through email. And once again, thank you so much, Professor Liu, for today's extraordinary presentation and your valuable time and contribution. I hope we can invite you for another program next in the future. Right.
Okay.
Please.
I'm very happy to see you. Okay.
Yeah,
Bye-bye.
Please give applause to Dr. Liu. Thank you so much.
Thank you. Okay. Thank you.
Thank you very much.
All right. Now it's time to me to invite the last speaker of today's international virtual seminar. Please give a warm applause and welcome to Professor Nur Salam. Assalamualaikum, Profesor.
Waalaikumsalam, Mas Adik. Terima kasih.
Pripun kabarnya?
Alhamdulillah, sehat.
Ya.
Pak Mubin sehat nggih? Pak Mubin, Pak Watek 1 nggih.
Alhamdulillah. Sehat, Prof.
Nggih, alhamdulillah.
Barusan selesai Bu Erna aja, Prof.
Oh, nggih, selesai. Tinggal
Terima
satu
kasih
lagi.
bantuannya, Prof.
Nggih, monggo.
Oke, Prof Nur Salam, thank you so much for your willingness attending this invitation to be one of the keynote speaker in the virtual seminar. I think it's acceptable for you ngagem bahasa Jawa, mah ngagem bahasa Indonesia, apa ngagem bahasa Inggris.
Gaduh-gaduh ya Mas Adik.
Yeah, it's fine, yeah, because banyak dari mahasiswa yang ikut, semoga nanti bisa.
Dari luar ada nggak ini?
Ada
ya?
Prof, ada
beberapa. Okay, I will mix. Yeah.
So before the presentation begins, allow me to briefly introduce our last speaker, Professor Nur Salam. Let me to share the screen first to let the audience know about your briefly profile. All right. Professor Nur Salam is the really notable and excellent nursing professor in Indonesia. He held a doctoral nursing degree in 2005. He also very famous, productive nursing author and researcher. He had published more than 200 more papers. Nggih, Prof, nggih. 200 lebih ya. In the excellent national and international journal. And recently, he received a remarkable award as a top 17 authors in the Indonesian journal. All right. For a simple reminder, all of you can download the Professor Nur Salam biography information and his presentation in our website. And please also teman-teman sekalian bisa write down the pertanyaannya di kolom chat ya nanti, atau bisa langsung diutarakan ke Prof Nur Salam. Lebih enak pakai bahasa Indonesia nggih, monggo saged nanti bisa saya terjemahkan if you,
Basa Jawa nggih saged.
yeah, if you come from outside of Indonesia, you can you can use English. Insyaallah, Prof. Nur Salam can respond you very well.
Insyaallah nanti translate Mas Erik ya.
Alright, ladies and
Baik.
gentlemen, now I will turn the screen and time to Professor Nur Salam to deliver the presentation about research and design approach in nursing research and publication. Time is yours.
Stop screen dulu Mas Erik ya.
Sampun,
Baik.
sampun, Prof. Ya.
Assalamualaikum warahmatullahi wabarakatuh. Sudah kelihatan Mas Erik ya?
Sampun, sampun.
Oke.
Sampun, Prof.
Sampun,
Oke,
sampun,
untuk
Prof.
Mas Ubin. Oke. Thank you very much, especially Pak Mubin, Pak Wadek 1, Pak Dekan, kemudian para pejabat yang tidak bisa saya sebutkan satu persatu Mas Ubin ya, termasuk Bu Mahmuda, Bu Erna, ini Mas Moderator Erik ya, Mas Erik, luar biasa. Thank you very much. Saya akan mix nanti untuk penggunaan bahasa. Mudah-mudahan nanti bisa lebih implemented gitu. Tadi sudah kita dengarkan yang disampaikan oleh Dr. Liu, Dr. siapa Mas Erik?
Dr. Liu.
Panggilannya?
Dr. Liu.
Liu ya.
Yeah.
Saya tambahin Dr. Liu Eko Mas. Eko itu karena setiap saat ngomong dia menggunakan oke ya. Jadi oke tidak Eko. Jadi Liu Eko.
Leres, Prof.
Catat oke-nya setiap pernyataan berarti Eko ya. Jadi orang Indonesia sebenarnya dia. Baik, thank you very much. I would like to present especially in international nursing publication on R&D ya. Jadi fokus saya pada research and development. Tadi sudah sampaikan Mas Erik, this is my publication, current research. I got 28 and the publication 216, Scopus 110, and International Reputed Journal 32, and national this one, and book reference on 16 ya. Alhamdulillah, syukurillah ya. Jadi mudah-mudahan nanti Mas Erik dan teman-teman bisa masuk di Sinta ya. Kalau kita lihat di Sinta itu penulisnya ada 197.000 Bapak Ibu ya. 197. Jadi dari berbagai profesi ya. Jadi bukan hanya keperawatan tapi berbagai profesi luar biasa. Dan itu kita nggak pernah tahu, nggak pernah ngirim apa-apa, tapi data kita harus ada. Oleh karena itu teman-teman nanti you need to have the social media. In social media you can access like this one. When we click for Scopus for example, then this one is my publication yeah, and Orchid, Sinta, and others. So when we look at this one, our position, for example, in Sinta, we can look at ya. Jadi kalau kita klik yang di sana tadi, kita melihat Sinta, saya posisi di mana. So you can look at this one in Sinta reputable. Kalau saya sekarang dinilai, itu sudah melorot urutan 25 ya. Tuh, kalau di UNER biasanya saya selalu ke pertama, ini sudah kedua ya. Jadi itu bergantian ya, needs for this one ya. Jadi ini beberapa yang saya rasa kalau teman-teman nanti bisa cek di di sosial media tadi yang saya contohkan tadi, itu bisa digunakan di sini ya. Semuanya bisa ResearchGate, Akademi Edu. Jadi data tadi yang bisa you can look at in this social media. So sorry, just a minute. No, I stop screen first. Alright. Okay. Balik ke PPT ya Mas Arik ya?
J, Prof.
Already? Okay, mantap. Okay. So, in research and development, actually we need to have ideaton ya. In ideaton in this pandemic era, actually inspire us to write more ya. Because in ideaton, especially in this pandemic era in COVID-19, so we have a 3I ya. Jadi kita harus punya 3I. Number one is imagination. So we need to have a dreaming ya. It's not only mengejar mimpi, but we create the imagination. Yeah. Number two is we need to have the idea. Idea can be implemented to write down on proposal and some kind of books and others. And then the next one for implementation. So this one is the meaning of R&D. Jadi kalau kita penelitian basic R&D adalah bagaimana implementasi yang kita lihat tadi. So number one, quick look at, I just focus on, because when we are going to publish the goods quality of publication, sekarang ini ada kata-kata gini Pak Umpin, jadi kalau publikasinya banyak tapi nggak pernah mendapatkan hibah jurnal, itu juga dipertanyakan. It's questionable. Ya. Jadi penelitiannya kok banyak, mana hibahnya? Makanya itu harus juga. Ya. So we need to have a good, number one is we need to have a good research proposal. Jadi kita harus punya research proposal ya. Alhamdulillah saya dengan Bu Erna tahun ini kita saya mendapat hibah sekitar 10 hibah ya, 10 dari Simlip Tapmas dari berbagai, termasuk dengan Bu Erna ini tahun ini juga dapat ini beberapa. That's the model ya. That we need to have imagination and then we have idea. Ide itu harus dituangkan di situ ya. And then next one, saya yakin ini saya tidak menjelaskan di dalam berbagai the basic for approach in research. Tadi Mas Eko tadi, Dr. Eko tadi sudah menyampaikan many research. One of the question is there the beginner should write down on cross-sectional study and others. I think that's the basic thing, yes, yeah, we can use for correlational, yeah, or maybe case study, ya, Pak Eko tadi mengatakan case study and the others. So this one, I'm talking about how to have in applied research, ya, applied research here. So where do you start? Nah, ini pertanyaan. Like this one, when we try for stairs here, we always say journey of 1,000 miles can be begun with single step. Itu kata-katanya. Jadi perjalanan panjang itu bisa dilalui tahap demi tahap. We cannot instant, ya. Jadi kita nggak bisa instan, ya. Jadi untuk menghasilkan karya-karya itu pasti sedikit demi sedikit, ya. Jadi saya sering mengatakan kita harus menghilangkan singkatan saya P5M3. P5M3 itu kita harus menghilangkan pesimis. M yang pertama malas. M yang berikutnya mengeluh. M yang kedua adalah mendendam, ya. Mengerasani. Nah itu nggak boleh ya bahasa Inggrisnya. Jadi so we need to optimize. And then we nggak boleh malas, harus lebih rajin, karena sebenarnya dalam tulisan is not how the the IQ, but the important things is how we can discipline. Ya ini yang penting ya. Jadi sukses seorang itu ditentukan oleh disiplin seorang. Ya makanya di riset itu singkatan kita nggak boleh kena penyakit kulit, namanya kudis, kurang disiplin. Ini nggak boleh. Kutil, kurang teliti, ya harus teliti, gitu ya. Kurap, kurang rapi ya, jadi harus teliti, harus disiplin, harus rapi. So this one. Ini pertanyaan tadi yang disampaikan oleh Dr. Liu tadi. So, nah saya ingin mengatakan cobalah sehari, just 1 hour or an hour a day, you try to focus on the research. So you can read a journal, the article, write down something, yeah. So for essay, so this one is your time. If you never ever start to do something like this one, don't never ever dream about a good in research. Jadi kita jangan pernah bermimpi kalau kita waktu kita habis Pak waktu saya. Kalau saya nggak habis Mas Erik, kalau saya PPS itu pura-pura sibuk Mas Erik. Jadi orang itu biasanya nggak sibuk tapi hanya PPS saja, pura-pura sibuknya. So saya kalau biasanya ya pagi mungkin setelah subuh 1 jam saja. Ibu mungkin malam gitu. Kalau pagi kan anaknya rewel, bapaknya rewel gitu ya. Kemudian juga banyak pekerjaan ya. Kalau ibu-ibu bisa. Jadi just spare times for an hour. And then how to strategy in research. Jadi di dalam riset itu harus mengandung namanya meaningful research and community services. Jadi so the good idea in proposal usually based on meaningful research. Jadi riset itu harus diberikan makna ya. Bagaimana bermakna untuk komunitas juga. Yang kedua adalah accelerating innovation and enterprising. Inilah yang nanti Pak Mupin, especially for the students. Biasanya kita akan ikut apa yang PIMNAS ya. PIMNAS itu we lose for this one because we never ever do for this one. Jadi kalau kita R&D nanti kita akan membangun we develop for this accelerating innovation and enterprising. So this one I think that's focus. So tips and trick in R&D, especially saya punya 5 tricks. Number 1, the topic. Jadi topik itu nanti harus consist of NOCT, novelty, ada kebaruannya, originality, ya. Jadi harus khasnya, contribution, ya, kontribusinya from the practice and theory. Tadi kalau sekarang, for example, in nowadays you contribute for innovation regarding for how to handle COVID-19, for example. So this one is the contribution. And the last one is about the trend and prevalency. So I got this year 3 or 4 grants in research, especially the topic for COVID-19. Jadi tahun ini saya mendapatkan grant yang bervariasi, ada 4 ya, yang didanai lumayan lah untuk adik-adik nanti ya, minimal 200, 250 kan lumayan ya Mas Erik ya, bisa digunakan. So this one I think that's good. So number 2 is references ya. So the references, I think this is our weaknesses, especially for Indonesian student, for nurses student. So when you do for references, I always ask, so please do for the international reputation for IC Thomson or Scopus. At least minimum Sinta ya, Sinta jangan Sinta sampai 10. Ya ada Sinta 10 saya enggak ini, hanya Sinta 1 2. Untuk S2 ini ya, magister student Sinta 3 paling kurang ya. Last 5 years. So this one is the modal. Jadi modal kita tuh di sini. Kalau nanti referensi aja meragukan ini diambil dari mana gitu, so it is questionable. If you for reference for books, publisher authors with credibility. Jadi harus mengambil buku referensi yang publication is credible, bukan hanya publikasi yang di tengah jalan. The authors itu juga harus credible. Ya, ini saya rasa menjadi, nah, nomor 2 ya, jadi NOCT, referensi. Nomor 3, tadi disinggung banyak oleh Dr. Ryu tadi, I have these things to produce for publication, good publication, especially for magister students or, undergraduate students as well. So you can focus for, you do for cross-sectional study, for example, I ask my students always at least minimum 100 sampel. Itu minimum. Jadi S1 pun bimbingan saya nggak ada yang kurang dari 100 kalau cross sectional. The more we have a sample, it is the possibilities, the potential to be achieved, to be accepted in international journal. Jadi kalau sampel kita hanya sekian, ya jangan berharap banyak cross sectional. Nah ini ya. And variable at least 3. Jadi jangan hanya hubungan pengetahuan dengan tindakan, no. So you need to have more. For example, factors contributing something ya, faktor yang mau mempengaruhi apa misalnya, Y-nya ya. Jadi we need to have more than 3 variables. Number 3 is in experiment. Jadi kita nggak boleh hanya satu kelompok, just one group. We need to have 2 groups. Ya, 2 groups. Dan setiap grup, each group at least 30 sampel. Jadi jangan kurang dari itu. Oh, satu grupnya 10, nggak boleh ya. Minimal 2 grup, bukan hanya pre-post, apalagi S2. Nah, intervention, it should be based on the theory. Ya, harus didasarkan pada teori regulation. For example, assuming that you are going to research on how to, to care for diabetes ulcer. So in diabetes ulcer, need for 3 months, for example. So you need to have a time, we have for FITT. FITT mean frekuensinya, intensitasnya berapa kali, tipenya seperti apa, waktunya. Nah, ini harus dijawab. Ya, jangan sampai so you cannot just say, "Oh, intervensinya edukasinya cuma sekali, Pak." Padahal harusnya 3 bulan. Misalnya gitu. Berapa lama, berapa kali? So, ini ingatan kita adalah FITT. Nah, ini jenis yang bisa. Jadi, so for the beginners, you can choose for the model cross-sectional here, it's okay. Number 2 is okay, no problem. Qualitative is okay. I show you later. I have a research for 3 years funded by Simliptak Mas, lumayan ya, 200 ke atas. So in this funded, I first step designing the intervention. Jadi designing the instrument by using for qualitative study. Jadi begitu caranya. Namanya itu explanatory research. Jadi kualitatif ini minimal kalau bisa ada 12 partisipan. Lebih banyak lebih baik. More than 12 is great. So 17, 20 is good. Theme, usually you need more than 3, not only one theme, for example. So my theme is what how to prepare the psychosocial emotional before doing for diagnostic test for endoskopi. Jadi persiapan psikologis buat pasien endoskopi dengan pendekatan hipnosis, for example. Ini contohnya. Ya. Jadi ini kualitatif. But it's not ending in this one. Kalau S2 bagaimana? For the magister student, you can kualitatif and then you produknya nanti harus ada namanya modul atau bahan. Number 2 untuk S2 eksperimen, bukan eksperimen langsung. Jadi harus 2 tahap, 2 step. Number 1 is kualitatif study, baru eksperimen. Sehingga nomor 1 tadi punya modul, punya instrumen. Nah, cross sectional tadi outputnya adalah instrumen, begitu ya. Jadi ini semuanya R&D itu bicara tentang bagaimana. Ini R&D tadi yang saya ceritakan juga sama. Ini ada 6 langkah yang saya buat, 6 step, and article literature review, systematic review. I'm not recommended this one in the last ya. Jadi ini kalau saya biasanya yang terakhir saja. You can use for Google Form, you can use for enumerator by collecting the data. So you cannot just rely on okay, this is pandemic, we cannot distribute the the participant. I use for mix for Google Form and also questionnaire. In one of my research, I got for 1,200 sample. So this one I think is the credibility of the research yang nanti dapat didanai, dapat dipublikasi is this one. Ya, jadi itu. Number 4 is language of course ya. Jadi bahasa Inggrisnya harus baik. Jadi kalau kita nggak bisa bahasa Inggris kan sekarang bahasanya mama mendorong sapi. What is in English? Mom push cow ya. Jadi mom push cow. Jadi mama mendorong sapi. So you need to speak in English. You need to write down in English. Good in English is not only in speaking but good in in writing, in reading, smart reading, smart writing. So and the last, when you publish on this one, ethical clearance. You need to, to have a ethical clearance. Jadi harus ada uji kelayakan etik. Jadi kalau mau publikasi, jangan pernah berpikir nggak ada ethical clearance, Pak. No. Ya ini, so the 5 tips ya. Jadi kalau nanti ingin bagus, bisa diterima, termasuk didanai. So funded by all of the funding, and then for publication, we need to have a modal. Jadi harus punya modal dulu. Kalau modalnya bondo dengkul, bonek ya, bondo nekat, cross sectional, sampelnya 30, hubungan pengetahuan, sikap, wes lokro lah, ya nggak bisa, ya. So this one I think we need to have something NUCT tadi, novelty, original, but in methodology, so we need to this one, ya. And then how to start in research, ya. Saya hanya review how to start in research. Saya memulai. In the last, for maybe years ago, I have give a class, give lecture in Muhammadiyah Semarang class, a student, but maybe it's not for magister student. In the research, you need to start in 7 steps, yeah, M1, M2, and P. I have for this one. M1. Jadi kalau memulai riset itu ada 7 step itu gini. Keilmuan saya, misalnya Mas Erik ini di KMB atau di komunitas. And then kita lihat. Misalnya apa? Wah, topiknya nanti misalnya di mana? Ini kita pilih. Wah, I'm critical care. Bu Irna misalnya di medical bedah for medical HIV. Jadi ini deciding the case study and then what's the case. Ya, jadi kasusnya apa? Cara milihnya begitu. Nanti peminatan manajemen, misalnya manajemen itu ada 4 area besar. Ada mutu dan keselamatan misalnya. Kemudian area tentang pelayanan, manajemen pelayanan. Manajemen strategis gitu. Misalnya gitu. Gender sumber daya. And then what is sumber daya mean? Oh, saya tentang konflik. Ya, misalnya gitu tentang QNBL, Qualityness Work Life. Begitu caranya mencari. Ya, so deciding case from this one, and then next step we have for searching the problem. So in the research you need to focus on what's the problem. Jadi mencari masalah, ya. Sama, kenapa saudara semuanya kok cari masalah gitu. Seperti hari ini kan sebenarnya cari masalah yang sedikit ya. Kenapa harus ada internasional ditugaskan oleh Pak Mupin misalnya? No, because you have the problem. Less publication, the student lack of experiences in publication, something like this one, and so on. Jadi masalah nanti harus kita urutkan based on this one. Kalau saya mengambil misalnya Bu Mahmudah yang di maternitas misalnya, Ibu di sini ada maternitas, ada prenatal, internatal dan seterusnya. Nanti dicari what's the nursing problem, gitu ya. Saya seperti kalau Ibu internatal apa saja, nanti kita ambil satu aja, ya pembukaan serviks, ya misalnya nanti ada kala 1, kala 2, kala 3, kala 4, kala itu, ada seperti itu ya. So this one you can use. Ya, jadi misalnya di sini tentang perawatan pasien. This one is what's the problem, ya. Nah, setelah misalnya saya mengambil di involusi di postnatal care, topik involution, next step kita membuat nama spider web. Itu cara explore, ya, menggali suatu masalah. Postnatal care, ya, postnatal care itu ada banyak jalurnya. Dari jalur sini misalnya kita bisa misalnya postpartum blues gitu. Di sini misalnya ini, ya di sini misalnya episiotomi ini, ya misalnya di involusi, ya kita bisa seterusnya itu. Nah itu contohnya. Jadi kalau kita melihat, so you can use for this one, especially in spider web, illustrates, in general, in comprehension for the problem, especially in nursing research. So just take one, for example, in incontinence and in postpartum blues, And next one is, cari referensi. Jadi referensinya harus dicari. Jadi kalau yang terkait tentang misalnya involusi, semua penelitian tentang referensi. Makanya in our study, especially in doctoral studies, we ask the student to write down, it is compulsory to write for article review. Related for article review. Jadi keaslian yang riset. Misalnya kalau ini ya harus terkait ini. Ya. Seterusnya, misalnya lansia. Saya ingin mengambil tentang lansia tentang so focus on lansia is good, not what's the dementia or gangguan kognitif. Ya. So if you focus on this one, you need to write down what is in the research related to this one. Like does music enhance cognitive performance? Ini semuanya ingatan teman, increase recall performance dan seterusnya dan seterusnya. Itu kita skip. Sama kalau kita misalnya anak dengan ADHD, so we look at this one, our spider web. So this one is references. So all is what the talking about ADHD. Jadi attention deficit hyperactivities and disorder. So this one, I think the compulsory, and then we need to have the diagram flow. Saya namakan yang sering kita namakan prisma ya. Jadi prefer reports item for systematic review. For magister student, especially you need to have this quality on this one. Jadi nanti dari sekian 170 referensi kita lakukan namanya ICI. ICI itu identification, screening, eligibility dan included. Nah, barulah nanti dibuat PICOS atau PIOS ini. Nah, ini salah satunya nanti di magister student saya rasa penting, termasuk ini beberapa yang bisa. Jadi misalnya Scopus berapa, ProQuest berapa. Ini contoh mahasiswa S1 nanti bisa kita gunakan. Jadi so many. Okay, next one is step 1 is write for literature review. Jadi nulis bab 2 dulu, tinjauan pustaka ya. Yang intinya saya sering menyebut 4S ya. 4S itu sistematika sesuai pedoman, citasinya, sentennya sampai dengan substansi. Kemudian berikutnya nanti cara mencarinya begini, model yang panduan itu. Nah, kemudian yang berikutnya adalah write framework. Kalau itu kuantitatif, kita perlu kerangka konsep atau kerangka teori. Yang kita kembangkan didasarkan pada based on theory, relationship with variable, and then the structure. Susunan kerangka konsep itu adalah ABC, antecedent, behavior, konsekuensi. Seterusnya, nah ini contoh nantinya kalau misalnya kita R&D adalah kerangka konsep seperti ini misalnya. Jadi manajemen asuhan rumah pre-operate berbasis SDKS, LKI, SIGI. Ini contohnya ada 6 langkah. So what kind of instrument? What kind of contributing factor? Jadi di dalam R&D nanti, di dalam kerangka konsep, so you don't have to, for antecedent here, for organization, individual, and objective, you don't have to, to do for researches, but include this one, but focus on this one. Ya, jadi nanti yang kita lihat itu adalah ini isinya, judulnya, standar diagnosisnya, dan seterusnya. Ini R&D ya, yang sudah di Scopus juga. Ini yang tadi saya ceritakan, yang mendapatkan dana hibah dari Simlab Tasmas 3 tahun ini. Model penyiapan psikologis dengan pendekatan hipnosis dalam meningkatkan kesehatan pasien endoskopi gastrointestinal. So this one, you can look at this one, for number one, for based on what we call is Roy theory. Jadi teorinya Roy itu kan ada stresor dan seterusnya itu. Ya nanti ada seperti ini tahapan-tahapan stresor, coping ya, kemudian ada efektor ya, kemudian nanti baru di situ. Jadi polanya jelas dan ini ya alhamdulillah sampai 3 tahun di dana. Nah, step 6 ya, baru tahap ke-6 baru kita nulis pendahuluan. Jadi saya mohon Pak Mubin, Mas Erik termasuk Bu Mudah nanti kalau meminta mahasiswa jangan langsung bab 1 mana lah, enggak bisa. Kalau belum melalui 1 2 3 4 baru 5 baru kita nulis bab 1. Karena bab 1 isinya background itu MSKS luar biasa, question dan seterusnya. So this one. Ya, barulah kita tujuan yang terakhir adalah judulnya apa. Nah, ini yang harus kita buat. Jadi jangan kita mikir judul tapi mulai tahapan 1 2. Itu tipsnya, ini beberapa hibah penelitian yang sekarang masih berlangsung dan mendapatkan, salah satunya ini ada punyanya Bu Erna yang tadi tentang pemberdayaan keluarga ya, termasuk pada pasien dengan HIV ya, ini sebenarnya. Ya, partner ya, ini tadi yang kita lihat. Nah, dari situlah baru M2. Jadi baru kita bicara tentang methods. Jadi jangan bingung dulu mikir metode. Metode itu nanti. So, the methods kita tulis di SPIA. Jadi kalau misalnya yang judul seperti ini, pengembangan instrumen asuhan perawatan, metodenya apa? R&D, desainnya. Sampelnya apa? Sampel pertama silakan. Pasien atau mungkin pakai rekam medis, silakan. Berapa? Variabelnya apa? Nah, nanti apa yang kita cari? Tadi sudah kita lihat di kerangka konsep itu. Alat ukurnya apa? Nah, ini juga kita gunakan. Jadi kalau alat ukur bisa kita pakai WOD ya, wawancara, beda observasi, bisa dokumen gitu. Kalau kuali. Nah, baru analisis datanya apa? Tadi disinggung-singgung banyak. Dr. Rio tadi itu misalnya untuk sampel tadi misalnya ada uji power, itu boleh besar sampel. Kalau terserah. Nah, yang inti adalah topik tadi harus jelas dulu, baru masuk ke M2. Nah, MM yang terakhir baru nanti masuklah kita ke penulisan. Ini saya masih mengungkapkan tentang desain R&D ya. Jadi penelitian itu, so in the research actually we have a qualitative and quantitative. So in quantitative, saya kebalik ya ini, mohon maaf ini saya kebalik ya. So ini kuantitatif di sana, kualitatif sini ya, mohon nanti dikoreksi. So qualitative like this one, number 3 is R&D. Jadi research and development itu salah satu di kualitatif ya. So division of research on development of methods, research and development like this one. New product, making perfect product existing. Ya, ini research from cycle with begin as needs. Jadi benar-benar kebutuhan. Research method use product, produce a product. Jadi ending from the R&D is the outcome is product ya, startup ya. Itu yang kita lihat. So characteristic of R&D is studying research finding. Jadi mulai nanti nih. Kemudian adalah developing the product, field testing, and revising. Ya, ini beberapa tahapan yang secara detail kita lihat ada basic research sampai ke applied research. So we need to have this one in product here, and then for implemented. Ya, jadi ini like descriptive, evaluative, and experimented. So this one type of R&D yang detail R&D. This is my type yang I have developed this type for R&D. So we have a 6 step. Ya, saya kalau membimbing R&D untuk mahasiswa S2 biasanya number 1 is studi literature study and then for collecting data. Number 2 is developing by FGD, konsultasi pakar, uji validitas. Nah, number 3 and 4, 5 untuk S2 tidak dilakukan. ya, langsung final product dissemination. Jadi untuk nantinya kalau untuk magister, karena kalau ini nanti butuh setahun lama, kalau untuk S2 mungkin 6 bulan, number 1, number 2, number 3, number 6, directly number 6. Sehingga outputnya adalah produk, apa startup atau apa nanti kita contohkan. Ini tahapan-tahapannya 1, 2, 3 tadi. Tahap kedua adalah bagaimana sebenarnya ini tadi langsung kita nanti ke rekomendasi. Ya, ini sebenarnya this one is the R&D Book and Gale, yang secara lengkap ya. Ini saya tidak membahas ini, nanti tolong dibaca sendiri waktunya nanti diingatkan Mas Erki. Next one, kita P ya, bicara tentang P ya. Jadi riset itu ada MMP tadi. Jadi ada masalah, metode, ada penulisan ya. Kalau dalam bahasa Inggris ada problem ya. And then for methods, and then for publication atau P ya. Jadi PIP. Ini ya, saya contohkan real pengembangan clinical pathway pasien CV infak. Ya, ini how to develop the clinical pathway program study ini contohnya ya. So when this one is the journal that's already published, the development nursing diagnosis and Indonesian nursing diagnosis standard on clinical pathway among patients with stroke infarction. This one is, you can look at this one is the product ya. Jadi product for R&D. Jadi judul daripada R&D kira-kira seperti itu. Nah, ini risetnya yang sudah publish. Nanti tahapannya sama. So for the step 1 is for background ya. Introduction, and then conceptual theory tadi sudah, and then for methods ya. Ini metode tadi ada design first phase 1 itu seperti ini, desainnya R&D. Nah, look at the population and sample. For the population for sample, first is clinical pathway itu ada 222 clinical pathway rekam medis. Ini pertama. And then partisipan untuk kualitatifnya ada 17 orang. Nah, this one for phase 1 ya. And then variable this one, and then instrumennya tadi kita lihat instrumen yang akan kita kembangkan nanti seperti apa. What kind of instrument? Karena produk kita ada instrumen, baru dianalisis deskriptif. So ini phase 2 baru diuji cobakan. Ini kalau 6 langkah tahap tadi lengkap ya. Kalau ini tadi kan saya potong hanya 1, 2, 3. Jadi studi literatur, studi lapangan, pengembangan, validitas, langsung rekomendasi. Tidak ada sosialisasi, tidak ada uji coba. Kalau nanti lengkap harusnya ada uji coba ini. Nah, ini uji cobanya, kemudian the result. Jadi cara menulis resultnya harus benar ya. Yang kita tulis sesuai dengan evaluasi clinical pathway. Caranya bagaimana? Ini yang kita evaluasi, tahapan-tahapan kita evaluasi, berikan komentar. So the comment you can use for interview, wawancara, observation, and document tadi, you can use for this one. Misalnya the content standard seperti ini. Kemudian nanti apa komen kita di situ. And then for pengesahan juga. So and then next one is tadi data kan kita ngumpulkan, kita ingin melihat nursing diagnosis, nursing intervention for stroke patient during ya selama bulan Agustus, Juli sampai November. Berapa pasien itu kita telusur yang stroke infark ya, CV infark itu ada Agustus, Juli sekian, November sekian, Oktober totalnya 112. The total is 122. Nah, baru kita list the nursing diagnosis-nya based on 3S adalah seperti ini. Nursing diagnosis kita list the top 5 nursing diagnosis. Jadi kita list 5 terbesar, tertinggi ya. Ini ada dari 122, 61% diagnosisnya adalah ini. Dan seterusnya ya sampai 5. Kemudian intervention juga begitu. Intervention we categorize to be OTEK. Jadi observation ya, treatment, education, collaboration. Itu kan di dalam 3S begitu. Jadi observasi, tindakan, edukasi, kolaborasi. Nah, ini list yang tertinggi dukungan mobilisasi. Jadi tindakan mobilisasi yang tertinggi ini kodenya di Siki ya. Jadi 61% dan seterusnya. Nah, ini data sudah kita kumpulkan, baru developing the clinical pathway. Nah, dalam developing clinical pathway, Bapak Ibu, all the participants need to have like focus group discussion and expertise consultation. Jadi itu tahapannya nanti disajikan seperti ini. Karakteristik dari APK, tampilan datanya nanti bisa, you can look at this one for strategic issue and others. What's the view for researcher. Next one is recommendation. What is our recommendation? This one. This one is step 1. And what's the product? Ya, I skip setelah recommendation tadi developing, and then we uji validasi tadi, and then what's the product? The products, the ending is like this one. This one is the product. So you can look at from the real. Jadi harusnya yang asli seperti apa? Ini yang sudah kita perbaiki. Look at from the, for reds, reds marker here. So look at this one is for infax ya. So length of stay. Jadi kita batasi length of stay is 7 days. And then we look at this one. Ini yang ada di SNAR, Standar Nasional Akreditasi seperti ini. Assessment awal medis apa? Kita nggak meneliti itu. Yang kita teliti adalah nursing assessment. Ini di dalam SNAR, terutama di dalam indikator area klinis. Ya, itu ada indikator area klinis, indikator area manajemen ya, Anda lihat. Nah, termasuk next one is the diagnosis. Nah, diagnosis kita lihat seperti ini. Nah, so this one, temuan tadi yang kita list adalah, kemudian juga di dalam intervensi ini diagnosis masih, and then SIKI ya, SIKI-nya sampai kodenya ada. Nah, inilah output produk yang kita hasilkan, termasuk di dalamnya, sehingga nanti akan bisa menjadi penggunaan untuk clinical integrated clinical pathway sebagai pedoman praktek ya bagi all the health worker, jadi tenaga kesehatan yang ada. And the next one is the example. I'm not going to continue for this one. Like this one, just the example for development of perioperative nursing instrument based on SIKI tadi. So look at this one for result and others. Ya, tadi sudah termasuk what's the results. Jadi nanti kita perlu what's the instrument. Produk instrumennya seperti apa. Nah, you can look at this one ya. Like insight test nomor 1, diagnosisnya insight test, kodenya seperti ini. Jadi nanti tinggal centrang-centrang. Kalau nanti pakai startup lebih enak. Kemudian diagnosis untuk nyeri seperti itu. Okay, this one is the product for R&D. So you can have the product for this one. And next one, I give you an example for ECG algorithm interpretation based on Android application for nurses. This one for startup, ya. Jadi startup ini juga sudah di dalam suatu jurnal, ini description, knowledge, skill dan seterusnya by startup, ya. Jadi startup interpretation saya tunjukkan data-data the presenting, ya, so this one is the startup, ya. Jadi startupnya namanya AC. Jadi itu the application for nursing intervention and also for ECG for this one. Ya, ini nanti kalau kita patenkan dari startup, inilah R&D product. Jadi jangan sampai kita when we do for the research just finish until publication. No, you need to have for product. HAKI yang tadi kita lihat. Ini yang tadi develop model of ECG algorithm like this one. Kalau kita nanti klik ini, so our students, our nurses, especially the new nurses can learn from this one. Next one is this is my grand research ya, yang now is still running ya, ini tahun kedua, tahun ketiga, especially membuat namanya, kita namakan ALISA nanti ya. Jadi automatic revenue for fluid management on hemodialysis, ini juga sudah dipublish di dalam Scopus gitu, yang nanti ALISA-nya seperti hasilnya adalah seperti ini ya. Ini beberapa yang nanti bisa kita, you can look at for ALISA for discharge training. Nah, okay, this one for before STEMI, for example for STEMI care ya, ini contoh yang STEMI. And so last one, 5 more minutes ya. Nah, R&D publication. So after we have a good, very good for in research, in for MMP tadi ya, mulai masalah ya, metode, and then penulisan ya. So now we start for repetitive journal. So di jurnal nanti kita lihat, you look at for number 1 is title ya. Title itu nggak boleh 10 kata ya. Jadi jangan terlalu panjang. Abstrak nanti ada beberapa. Jadi kita masuk satu But in writing abstract, nanti kan seperti ini urutannya. This one is like this one. But when you start writing abstract, start for a manuscript. Jadi kalau nanti menulis manuskrip, urutannya yang ditulis dulu adalah ini dulu. Tadi ditoto lagi 1, 2, 3, 4-nya. Ini sudah saya contoh. 1 nanti title, tapi nulis pertama metode dulu. Metode ditulis di SVA-nya. And then ini contohnya, ya. Nanti study design dan simpel-simpel saja. Termasuk variabel data analisis. Nah, di SVA tadi harus ditulis. Ya, IPN. And then for result. Result itu table, picture, diagram, and word. Jadi describing words. Biasanya di situ ada karakteristik responden. Lalu dilihat seperti ini. Jadi jangan lagi for level for magister student, you write like pie, ya, buntur-buntur banyak umur sendiri ini sih jangan. Ya. So this one multiple linear regression that you use for linear regression, ya. Jadi nanti kita lihat seperti ini. All variable. This one more complete, ya. Saya association between Helicobacter virulence factors include and clinical presentation. Jadi kalau gastritis seperti apa. Nah, jadi tabel ini, so the result is very important because when you write down for the results, so this one is more, precisely and then good in, flow for this one. So this is very important. Number 3 is introduction. Jadi nggak usah banyak-banyak introduction, kira-kira 1000 sampai ini 3 paragraf saja. 3 paragraf, ya. Paragraf pertama, first paragraf masalah. Ya. Istilahnya masalah itu ya F1, F2, ya. Jadi kalau tadi misalnya for example we have for the problem is about the implementation of 3S for example. And then what's the causes, ya. And then the scale, ya. Scale itu data-data, skalanya seperti apa. Nah, final paragraph itu kronologis, ya solution itu jadi disilesi. And the last, jadi nanti kalau nulis introduction dalam 1000 kata, ya, 1000 sampai, ya, itu akhir itu harus ditulis tujuan penelitian. Jadi contohnya seperti ini. Therefore, the study aim to, nanti ini tidak usah ditulis, langsung tujuan aja. Jadi tujuan yang ditulis adalah tujuan umum. What's the objective of the study? Ini di abstract. Jadi nggak perlu tulis lagi what's the objective number 1, objective number 2, and others. So you can, this one we have 3 paragraphs, and then so this one. And discussion. So remember in discussion we have FTO, jadi fact, theory, and opinion. So in discussion should consist of FTO. For example, this one. The study shown that there is something like this one is fact based on finding, and then this one the theory. It says supported and others. So that's why this one you need to have a good in references. And the last is about the opinion. Ya, opini Anda apa, pendapat Anda. But you don't have to write my opinion is, no. Ya, jadi bukan ditulis pendapat saya adalah, bukan. But write down this statement based on the fact, on the result, and based on the theory. So you agree or some agree, like when we write down from the IELTS. Ya, and then the conclusion. Ya, maksimum 200 kata, 1 paragraph only. Ya, maksimum 3 and 4 sentences. Jadi jangan panjang-panjang. So the conclusion, and then the last one is the abstract. So abstract, IMRAT, ya, introduction, method. It depend on the journal. Jadi gaya selingkungnya seperti apa. But in general, introduction only 2 sentence. Jadi pengantar masalah, and then what's the purpose. Jadi masalah sama tujuan gitu aja. Ya, jadi jangan ditulis panjang. Terus metode di SVA tadi, result ditulis betul sesuai yang ada, baru discussion and conclusion. Dan keyword, ya, nanti ada orang nulis keyword ada L-nya, jadi namanya kalau ada L-nya namanya kunci dunia, ya. Keyword, ya, keywords 3 to 5 words. Jadi nggak usah banyak-banyak juga. Kalau di Malaysia itu boleh 4 sampai 6 kata. Nah, nanti nggak tahu di Taiwan, Mas Arik, nanti berapa. But in general 3 to 5 words is okay, ya. Itu abstrak, ya. Contohnya seperti ini. Introduction, ya. Di sini ada 2 kalimat atau 1 kalimat. Methods yang tadi di SVA, result and analysis, and then conclusion. Look at this one, ya. Di precise. Jadi nanti simple. Kalau kita in thesis, we need more than 250, but in journal, I think you need only for 150 is okay. Ya, 150 kata, words, ya. So this one is simple, consists of this one, just bold this one, tergantung juga gaya selingkungnya nanti. Jadi imrat tadi adalah ini. And the last one is title. What's in the title? Jadi and the referency of course ya. Jadi itu so this one and this one is some conclusion. I think that's my presentation, Mas Erik. Maybe any question that we can discuss for this study.
Yeah, Professor.
Sorry, I give for quickly because just browsing, reviewing, but I have for all the PPT.
Alright.
PPT tadi semuanya ada.
Okay.
Thank you.
Thank you so much, Professor Nur Salam. It's really incredible presentation. Sangat komplit menurut saya. Saya pribadi mengikuti dari awal. Design of research itself, it consists of PMP tadi kalau bahasa Inggrisnya problem, method, sama publication step. Itu sangat luar biasa ketika mahasiswa baik S1, S2, S3, S4 atau S-Teller gitu ya Prof. Itu bisa menerapkan semua desain tersebut. Insya Allah kita lebih pede insya Allah untuk publish paper, kemudian outputnya seperti itu. We will have a full confidence to publish our paper and look forward for the result and output.
Okay.
All right, we will go ahead for the question and answer session.
Right.
Since we don't have anyone type the question into the chat box, maybe I will ask anyone who would like to ask the question directly to Professor Nur Salam. Silakan bagi attendee atau partisipan.
This is the question, Mas Arif. For Erik, ada Bu Rufaida ya?
Oh ya. Rufaida.
They just us not to create the instrument because
ini
still,
buat buat Prof.
It's
for Professor Leo. Silakan monggo jika ada dari partisipan yang ingin menanyakan pertanyaan secara langsung pada Prof. Nur Salam, saya persilakan karena tidak ada yang menuliskan di ini ya chat. Boleh langsung mengutarakan pertanyaannya.
You can write down.
Monggo silakan. If you have any questions.
Silakan.
Wah, sudah jelas banget ini Prof. Pada paham. Keren Prof. Tadi saya juga mengikuti luar biasa tahap demi tahapnya dan kemudian tip, motivasi segala macam. Kami memang terinspirasi dengan apa yang sudah disampaikan Prof tadi itu. Terima kasih Prof.
Mungkin saya Prof
yang lain bareng.
Ya, monggo.
Jadi kadang-kadang kalau sepanjang itu ya saya membayangkan memang it's need a bleeding time actually from the beginning until the output process. I think for the normal people untuk kami ya mungkin untuk beginner researcher gitu Prof. Jadi mungkin bayangannya udah aduh ini mau selesai berapa lama untuk satu topik, kemudian sampai ke itu apa namanya ke melalui proses tersebut. Iya. Nah, mungkin sharing ini aja Prof, karena Profesor kan sudah sudah melalui banyak sekali ini ya pengalaman dan sebagainya. Mungkin sharing ke kita supaya bisa istiqomah dan apa ya namanya ya tetap inline at the way gitu ya. Itu bagaimana caranya Prof? Kadang-kadang kita kalau sudah aduh uangnya nggak ada, resource-nya kurang, udahlah selesai gitu. Pripun Prof?
Iya. Kita ini kadang terlalu baper sama koper ya, bawa perasaan sama korban perasaan. Kenapa baper, koper dikit aja kita sakit hati. Nah, saya rasa untuk itu makanya tadi saya katakan to be success is not the modal is only disiplin. Kita more disiplin itu saja. Modalnya hanya disiplin. Jadi tidak ada yang lain kalau tidak ada itu. Jadi artinya kita istilah Mas Arik tadi adalah istiqomah ya. Jadi istiqomah itu ya jangan isu dele sore tempe malam gosok gitu. Artinya semangatnya luar biasa awal-awal tapi habis itu nggak sampai gitu ya. Nah, so modal saya hanya bagaimana how to be more disiplin istilahnya kita itu yang harus dibangun. Jadi namanya disiplin itu kalau sudah jangan istilahnya gini Mas Ari, kalau kita sholatnya kusuk kalau mau meninggal aja gitu, misalnya gitu ya. Atau ibadahnya bagus kalau ini, kan nggak bisa begitu. Allah menilai kita itu bukan dari itu. Allah menilai kita ini dari konsistensi kita, terus-terusan kita, itu saja. Dan insya Allah itu jalan itu ada gitu ya. Terkait the problem. Misalnya rasa, oh saya belum pernah neliti, saya belum ini, dan seterusnya. Jadi selama kita istilahnya itu harus istilahnya KTB ya, KTB itu harus punya kemauan. Itu yang modal utama itu kan kemauan kerja keras gitu ya. T ini penting tadi Mas, telaten, tekun. Kalau nggak telaten, tekun ya nggak anu. Pak Kanip ini sudah anu ya Pak Kanip ya, ujian ya Pak. Harus tekun Pak Kanip ya.
Iya Prof.
Ini harus tekun. Jadi jangan kita, wah aku terlalu sibuk. Kalau saya nggak tak terima terlalu sibuk Pak. Karena waktu itu pasti ada ya. Jadi, sakit hati nggak usah, udah habis biasa aja gitu. Saya sering ngajari Pak Kanip dan teman-teman gitu. Nah B-nya itu harus mau berjuang dan berkorban. Nah berkorban apa? Struggling ya. Times, waktu, itu harus punya lah waktu space. Ya kalau nggak bisa pagi ya mungkin malam jam 2, 1 jam sampai 1 jam itu kan harus itu. Kalau nggak ada itu kan nggak bisa. Jadi modal utamanya menurut saya hanya di situ saja. Sehingga kita membiasakan kalau misalnya saya ditugasi Pak Mubin membuat proposal misalnya S3, mungkin dalam 2 hari saya bisa selesai. Karena wis dianggap biasa begitu. Ya modal saya karena disulin situ gitu. Jadi misalnya dikasih topik, boleh ini ada penelitian ini, saya bisa insya Allah 2-3 hari saya selesai. Misalnya begitu. Jadi ini akhirnya terpola gitu Mas Erik. Jadi terpola gitu Pak Mubin ya. Jadi semangat ya para mahasiswa, tidak kesuksesan Anda itu IQ Anda itu hanya 13% untuk kesuksesan. Tapi katanya orang yang kalau itu 3I lagi Mas Erik namanya. I pertama orang harus punya inisiatif. Nomor 2 orang harus punya integritas, sing jujur, nulung wong itu ya sing bener, ya jangan licik. Kita kan sering gitu ya, ya tulus gitu ya seperti itu. Yang berikutnya adalah involvement, mau kerjasama. Nggak bisa kita nggak bisa kerja dengan orang lain itu nggak bisa. Sehingga harus punya inisiatif, harus punya integritas, kejujuran, ketekunan itu penting, tanggung jawab, dan yang terakhir adalah kerjasama. Nah, itu yang saya katakan ini.
Integritas.
Ya, involvement. Bahasa Inggrisnya Mas Erik, involvement. Jadi keterlibatan lah dalam, jangan pasif. Kita ini jadi orang itu jangan pasif. Dan nanti kalau sudah, makanya saya tadi guyonan Pak Mubin, orang-orang banyak meninggal, bagi yang seperti saya itu bimbingan saya banyak yang belum lulus, jadi belum dipanggil Pak. Jadi karena masih harus diluluskan dulu. Supaya ini, guyonannya gitu kan, kita masih diberi tugas oleh Allah sekarang ini. Gitu ya. Nah, makanya harus banyak gitu Mas Arik.
Ya,
yang penting lagi
lulus gitu ya,
jadi kalau dosen itu kita kan maaf ya, dengan Bapak adik-adik misalnya magister mahasiswa S2, kita punya grant itu lumayan Bapak Ibu, membantu kita sekali.
Lumayan itu Prof.
Ya hidup kita ini kan SKM ya Mas Arik ya. SKM itu senang ya toh, syukur, karir, materi ada Mas Arik gitu. Jadi jangan hanya senang toh gak duit ya padha gitu Pak. Ada materinya, lah Pak Mubin ini ada karirnya ini, jaga duit ya kayak gitu ya.
Amin.
Berarti penting untuk menanamkan ini ya Prof ya, disiplin, kemudian konsistensi itu tadi ya, sehingga nantinya akan terpola dengan sendirinya. Kadang-kadang kalau tidak konsisten, kalau kebuatan konsisten biasanya memang sudah punya sebenarnya green desanya bagus.
Jangan takut bayang-bayang, especially you need to be optimis, tapi harus dimodali tadi. Udahlah saya itu yang nggak pinter-pinter nemen, misalnya gitu. Tapi saya harus kemauan saya harus keras, inisiatif saya harus keras gitu loh Mas. Nah setelah itu ojo loro latihan, tekun, telaten, tahan itu penting. Kalau enggak gitu loro latihan, dikit-dikit marah-marah, awas nggak bisa lagi. Sekarang mau meninggal kok mau loro latihan ya nggak boleh gitu. Nah, dan harus berjuang. Tanpa itu nggak bisa ya. Saya yakin kita semuanya sepakat seperti itu.
Prof Nur Salam, ada mungkin masih ada 3 menit ini. Kalau misalnya ada dari audiens yang mau menyampaikan pertanyaan ataupun pesan, enggak apa-apa. Wonten?
Sambil ini ya Mas Erik, saya menambahkan pertanyaan tadi yang ditulis di sini ya, saya membaca di situ. Project study and doing the translated instrumennya, terkait instrumennya. Jadi R&D itu sebenarnya sarana kalau kita membuat instrumen, sebenarnya pendekatan yang pas salah satunya R&D tadi, atau pakai kualitatif.
Kualitatif rian
Jadi itu bener-bener R&D. Jadi penelitian kita, saya membuat instrumen. Tadi misalnya instrumen itu kan alat ya, alat ukur. Saya ingin mengukur sesuai dengan yang jelas kan kebenaran itu 3 Mas Erik. Pertama regulasi. ya kan? Kedua, fakta yang ada di Indonesia, fakta lapangan. Yang ketiga adalah pendapat pakar. Jadi pendapat pakar bukan segala-galanya. Kalau bertentangan dengan regulasi, berarti kalau kita SNARS, berarti instrumen nanti harus sesuai, bisa diaplikasikan. Jangan sampai kita membuat sesuatu it's not implemented.
Betul.
It should be implemented. Nah, ini yang penting. Oleh karena itu di R&D tadi yang saya katakan, kita mendesain instrumen. Makanya number one tadi adalah kita harus mengevaluasi instrumen yang selama ini. Dari segi apanya? Ya, tadi kan kita lihat dari segi functionality, usability, efisiensi. Itu kan itu ya. Ada kata-kata itu. Istilah salah istilahnya SMP. Jadi standar, mudah, SME. Standar, mudah, efektif, efisien. Jadi instrumen itu harus sesuai standar dan mudah dan efektif, efisien. Startup itu harus dibuat begitu. Kalau enggak nanti malah membingungkan. Tadi misalnya kalau tidak sesuai di Indonesia. Nah, kalau penelitian kita tadi sudah dijawab Dr. Louis, kita modifikasi boleh. Karena itu faktanya tidak begitu. Contoh misalnya HARS, Hamilton and Series rating scale. Di situ kan ada takut pada ular. Masa penelitian kita di manajemen takut pada ular, kan enggak mungkin misalnya gitu. Nah, maka harus dikatakan mungkin takut misalnya penilaian daripada supervisor. Itu namanya modifikasi, maksud saya yang real.
Jadi kembali lagi dikembalikan ke konsepnya kan ya, Prof.
Jadi balik lagi ke situ Mas Erik. Jadi termasuk di dalam adik-adik S2 ya, saya ingin penelitian Anda itu harus yang tadi kalau eksperimen jangan menggunakan yang sudah. Misalnya pengaruh PLB, push sleep breathing ya, terhadap pemenuhan oksigen pada PPOK, pasien dengan COVID misalnya. Jadi kalau PLB itu sudah banyak, jangan diteliti, itu sudah ada. Nah, harus dimodifikasi. PLB modifikasi dikir. Nah, itulah kebaruan. Itu kalau eksperimen begitu. Nah, kalau misalnya cross-seksional, jangan hanya hubungan ini. Harus ada outputnya. Apakah itu suatu rekomendasi? Misalnya tadi, analisis faktor, misalnya kinerja, sebagai upaya meningkatkan kinerja. Jadi ada. Sehingga pendekatan nanti, selain faktor-faktor tadi atau pemodelan, nanti ada FGD, ada konsultasi pakar, outputnya adalah berupa suatu modul untuk itu. Itu kalau pendekatan cross-seksional. Nah, kualitatif juga begitu, yang tadi saya katakan. Saat ini kan persiapan pendekatan psikologis dengan hipnosis terhadap kesiapan pasien untuk endoskopi. Tadi kan 3 tahun saya mendapatkan dana. Kualitatif itu, kemudian endingnya saya membuat suatu instrumen. Instrumen apa? Prosedur untuk melakukan pendekatan psikologis itu tadi, gitu loh. Nah, tahapan-tahapan tadi, kesimpulan saya tetap mengevaluasi yang sudah ada, baru nanti mengembangkan dengan konsultasi pakar dan seterusnya, mendesain itu. Pakar itu termasuk IT. Jadi kalau kita mau membuat IT simple, nah baru nanti diuji validitas, direkomendasi. Itu kira-kira ending, mudah-mudahan bermanfaat. Matur suwun,
sekali lagi Prof.
Nur Salam. Sehat-sehat ya, yang penting kita
amin.
S3-nya tadi nggak sampai S4 Mas Heri, S3-nya serumun selamat Mas Heri. Tapi jangan S3-nya stress stroke itu, jangan ya.
jangan Prof ya. Matur nuwun sehat Prof. Nur Salam. Thank you so much for your valuable time and sharing session in this great occasion, and I hope sometimes Prof. Kerso bila diundang lagi ke Unimus untuk menyampaikan
kalau diperintah Pak Mubin ya harus itu.
Alhamdulillah, terima kasih Prof. Sedianya Prof.
Sekali lagi terima kasih Prof. Nur Salam. It's my honor to have you in your presentation today, and please give a warm applause to Professor Nur Salam.
Thank you very much.
All right. And ladies and gentlemen, our keynote season is come to an end. I would like to express my gratitude to all of the speakers and all of the participants today, and we appreciate for all of the participation of the participants. I hope you enjoy with this activity, and thanks again for joining us in today's seminar, and we hope to see you again in the next activity. Now I will turn the screen and time to the host, our master of ceremony. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Yeah, thank you very much, Mr. Eric, for conducting this seminar. Yeah, ladies and gentlemen, On behalf of the House and Committee, we would like to say thanks again for speakers and all of the audience for active participation. Hopefully, the presentation will give benefit for us. We have some information for all participants. We pleased to join our next seminar about critical article clinic that we will be held on August 27 until 28, 2021. And for further information, please you can check our website webinarkeperawatan.unimus.ac.id. And information for the certificate in this webinar, you can check in our website also. And thank you for all of the participants. See you in the next webinar. Thank you. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, I forgot to last meeting.
The recording has stopped.
Prof, terima kasih Prof. Mas Harik,
Pak Mubin,
Satria, panitia semuanya, sukses.
Prof kayaknya sudah keluar Pak. Kayaknya Prof Nur sudah pilih Pak.
Oh, udah keluar. Oh,
mungkin derek mawon di share.
Loh, ini ada orang Taiwan ini. Olin ini.
Ni hao. Ciao an.
Udah makan pagi, Olin.
Ni hao ma.
Ni hao ma.
Makan pagi bahasa sana Cinanya apa Pak? Cia Pak.
Ciao fan.
Iya, cia.
Cia. Nah, makan bersama apa Mas Harik? Ciaan ya.
Bahasa Demak itu kalau pas Olin di Demak itu. Cia.
Mungkin direct di-share nggih Pak Mubin, Pak Sanif untuk yang agenda bulan depan itu ada artikel klinik kalau misalnya rekan-rekannya. Mbak Olin juga nanti kalau teman-teman di Taiwan kalau misalnya ada yang mau ikut review klinik publikasi, jadi nanti bisa dikirimkan ke kami panitia. Insya Allah nanti akan ada 2 pembicara dari Taiwan juga yang ingin membantu kita untuk review artikelnya.
Iya, Mas Harik di-share juga itu. Gitu?
Nggih.
Selesai nih?
Sampun Pak Mubin, monggo.
Salam semuanya, terima kasih semuanya. Olin ini yang paling jauh nih.
Ya, selamat ya Mas Harik.
Lin, siapa Lin? Itu yang
Selamat.
Oke, udah kuliah belum?
Mulai
belum
masuk September ini, insya Allah.
Oh, iya. Beasiswanya Mas Harik, oke?
Dereng keluar. Ini insya Allah nanti untuk announce scholarship-nya September kemungkinan. Pasti.
Oh, begitu. Ya,
karena masih mundur semua ini. Untuk
itu nanti dibantu Olin itu beasiswanya itu.
Mas Arik keren.
Kenapa Bu? Lah saya nggak menyampaikan nopo.
Bu Erna, selamat Bu Erna, keren. Luar biasa
selamat,
Bu Erna.
Congratulations Bu Erna.
Semoga cepat jangan lama-lama untuk tertutupnya.
Sudah ada tanggalnya.
Oh, alhamdulillah. Ya.
Alhamdulillah.
Pengestipun doanya mawon.
Ya.
Kagum Bu Erna.
Dibantulin ya, oke Alin.
Iya Pak, insya Allah.
Ya.
Ini untuk mahasiswa semangat ya semuanya ya, sehat-sehat selalu. Ini banyak sekali mahasiswa yang ikut di seminar
materi
ini.
Prof Nur tadi keren banget itu, seneng saya lihat.
Kalau saged dibedah satu-satu Pak Mubin, misalnya satu-satu problemnya dulu, itu nanti bisa lebih
boleh. Dan lolos.
Oh, Enje.
Ini dengan Bu Ais. Keren kata Bu Ais, sama saya setuju. Mantap.
Nama moderator kok niki wow kok.
Rezeki Mas Harik ya.
Baik.
Ini ada Bu Puji ya, Bu Puji. Bu Puji, Bu Indah.
Oh. J.
Pamit nggih kula nggih. Yang laki-laki ini mau Jumatan.
Ya. Kula nggih.
Ya, saya izin pamit juga.
Terima kasih sangat.
Matur suwun semuanya.
Waalaikumsalam.
Salam.
Izin nggih.